Bwrdd da, croeso I gyfarfod y bwrdd. Good morning and welcome to today's Digital Health and Care Wales board meeting. As usual, we are holding the meeting virtually and we are broadcasting live, and there will be a recording posted on the website at some point in the near future that people can catch up with the meeting if they haven't been able to follow it live. Simultaneous translation facilities, as usual, are being offered as usual. People who aren't familiar with how to access those, if you hover your mouse over the screen, you'll see an icon, the second in the middle, second from the right. If you click on, it's a world icon. If you click on that and select English, if you wish to hear a simultaneous translation. As usual, board members might not always be looking at the camera, so please excuse us. We might be looking at another screen or papers in front of us. And today we're going to take two breaks. We'll take a short 10-minute break after item 5.2 and then a half-hour lunch break after item 6.1, and we're due to complete the meeting at approximately 2:15. Hopefully, if people had any questions on the consent agenda, they've been able to address those to the appropriate officer and get the responses they require. We've got two people joining us who aren't normally with us that I'm sure Rydian will introduce fully in the shared listening and learning item there, Sally Cox and Sarah Pantoni, but we'll come back to them, Sally and Sarah, in a moment when Rydian introduces the item. I've got apologies from Andrew Fletcher, who isn't very well at the moment. Ruth Glazard, the Vice Chair, needs to step out for about an hour at 1 o'clock, so we understand that, Ruth, so please do. And Marilyn may have a camera off because it just of personal circumstances at the moment, but she should be with us. I've got no other apologies, and I'm looking around the table, around the screen, there aren't any. Declarations of interest. I haven't been notified of any declarations of interest. Has anything occurred to anyone since looking through the papers? No, thank you very much. If I move then on to the consent agenda, and if people do have things, we'll try and find Chris will try and find a space in the agenda to cover them. So the first thing is to approve the minutes. Item 2.1 from the board meeting held on the 27th of March 2025. People happy to do that? Thank you. And then to note that there are no actions outstanding on the action log, item 2.2. To note the forward work plan report, item 2.3. And to note the 2024-25 quarters 3 and 4 decarbonisation return, item 2.4. Okay, then if we move on to the main agenda, and the first item, as usual, is the shared listening and learning presentation, and I'll hand over to Rydian Hurl, the Executive Medical Director, to introduce the item and to introduce Sally and Sarah Fully, who are going to be presenting. Over to you, Rydian.
Thank you, Simon. Hopefully you can hear me. I'll shout if there's a problem. I'm having some issues with my sound control here, so I'm going to go straight to introduce Sally and Sarah about the Paris report, which is published online, and this is a very interesting way of collecting the voices of the patients, all aged over 45, have a minimum of one chronic condition, who are using primary care services across a number of countries, 19 countries, and it takes into account their experience and draws some conclusions about what patients want from the service. So I'll hand over.
Thank you, Rydian. I'm Sarah Pantoni. I'm the Senior Program Lead from the Welsh Family and Health Centre, which is part of the NHS Executive. I'm going to start the presentation before I hand over to Sally Cox that will finish. As Rydian said, and thank you for the introduction, we're here to talk about the OECD, which is the Organization for Economic Cooperation and Development Paris report, and Paris stands for Patient Reported Indicator Studies, and some of the insights from the report and also opportunity then for wider analysis for Wales. Next slide, please. Paris is the first OECD outcome-based benchmarking. Is targeted at adults over 45, managed in the language of OECD is primary care, but from our context is very much around GP practices. and it's 19 countries took part. Wales is the only UK nation to take part. It's based on 2 surveys, one targeted at GP practices, of which we recruited 75 from across Wales, and the second one targeted at patients. And the patient survey particularly is very lengthy, it was about 120 questions, and it spans across a number of different person-centered care kind of domains. It includes some PROM, special reported outcome measures, and some PREM, patient experience measures, but then it looks wider. It looks at trust in the healthcare system, shared decision making, any kind of, as I said, person-centered care elements of a care, particular focus on chronic condition management, but includes patients that don't have chronic conditions as well. The data was collected in 2023, so it's still very much relevant and up to date. Can we go to the next slide, please? The work has been run as a collaboration between the Welsh Government, the Welsh Value and Health Centre, and Digital Health and Care Wales, with distinct role between us. So the Welsh Government obviously was the commissioner for the work, but also provided support and advice throughout, from design to delivery of the project. The Welsh Value and Health Centre, which is my team, part of which I'm part, provided the overall oversight of the project and responsibility for the design and delivery of the work. We also provided the clinical leadership oversight and stakeholders engagement and communication support. We're also joint data controllers with Digital Health and Care Wales, that has provided the, not only does it hold the data, has provided support to the OECD for validating and quality assurance the insights from Wales that has been included into the report, but also continues to provide leadership around the analytical Wales own analysis. It also provided information governance support and leadership. And as I said, any analytical insights are very much driven by the Digital Health and Care Wales teams that Sally heads. Next slide, please. The data, as I said, was collected in 2023. For the purposes of the OECD, we needed to recruit 75 GP practices and about 7,000 patients from those 75 practices. There was a requirement that patient would have seen their GP within the last 6 months and were coming from a private dwelling. So for the inclusion of the OECD report, just over 7,000 patients are included in that piece, and this is some of the insights that we're going to show you later on. But Wales approached this in a much more strategic model compared to other countries, and we actually widened our recruitment of patients. So we recruited patients from over 45 from 199 practices. So we ended up with a much bigger data set than the OECD requirements. So we have just short of 26,000 patients from across Wales. So it's a real wealth of information that we now hold for our own analysis, not just what we can learn from the OECD benchmarking. Next slide, please. And as I said, this is very much a reflection of Welsh Government strategy and their intent to transform NHS Wales into a value-based healthcare system with a focus on prevention and person-centered care, and also how digital technology can really help us transform the experiences and access for people in Wales, and particularly throughout that whole pathway of journey, from including primary care as well as secondary care and emergency care services. And a lot of the things that come out of the OECD report very much align with that. Includes, as I said, some patient-reported outcome measuring experiences as well, but it also has a focus on multi-mobilities. It looks at inequities across countries and populations, but there's a real focus on digital technology. And again, this very much aligns with the Digital Health and Care Wales' own strategies around making digital a force for good. Oh, and just to add, before I move on to the next one, as Ridian said, the report is freely available on the website, so I recommend, if people haven't seen it yet, it's a really interesting read, and we'll give you some insights now, but there's a lot more than what we can show you today. Next slide, please. This is the 10 KPIs, key indicators that are reported at the beginning of the report. This is not intended as a ranking of countries, but it's an easy way to learn from each other around different domains and different elements of care. There are 10 indicators, 5 of which are the one on towards the left-hand side of the table, which are based on PROM, special reported outcome measures. The 5 on the right-hand side are based on PREM, special reported experience measures. For ease of interpretation, anything that is blue is at or above the OECD average, and anything that is white is below. Wales is there on the red rectangular towards the bottom of the table. And as you can see, we have 3 indicators that are at or above the OECD average, and this is mental health, general health, and confidence to self-manage. But I'd like to stress international benchmarking are always quite complicated and difficult and complex pieces of analysis and work. And generally speaking, again, this is not intended as a ranking of countries, more a way of learning from each other. And then I'm going to hand over to Sally that will give you more of the insights from the report. Thank you.
Thank you, Sarah. So I'm Sally Cox. I work for DHCW in the Clinical Directorate in the information team. So I'm a data analysis manager, and I run a team that supports the Welsh Value in Health Centre in their data requirements. So I've been working with Sarah in the team and with Welsh Government around the data analysis side of the Paris study. So can I have the next slide then, please? I'm going to show you some of the main themes in the report. So Sarah's given you a quick overview of the KPIs. So some of these things I'm going to pull out are things that are important for Wales, but we don't have much time. So we're just going to look around care coordination, inequalities, digital access, and digital health literacy. So starting with care coordination here with this slide, the survey measured care coordination through 5 questions covering aspects like care being joined up, having a single named contact, an overall care plan, support to self-manage, and information to self-manage. So as can be seen, Welsh patients report experiencing low care coordination compared to other countries. And this is important as care coordination is a key element to improving outcomes and experiences, particularly those with multi-comorbidities, complex needs. Go to the next slide, please. So this shows a visual around health inequalities. So traditional health metrics such as life expectancy, mortality, and morbidity, they're well documented, but as we've said, less is known about disparities reported in outcomes and experience by patients. So here the respondents have been asked to rate their physical and mental health over a set of questions. For physical health, this included their ability to carry out physical activities and the levels of pain and fatigue. For mental health, it included questions on are we okay? Yep. Included questions on quality of life, mood and emotional state. So the differences in the average scores are plotted above for men and for women, and the survey reveals significant health inequalities, with women reporting poorer physical and mental health outcomes than men across all the countries. However, Wales does have one of the smallest gaps in physical health and is also below the OECD average for mental health. So it's more positive for Wales. Next slide, please. Okay, so digital. So as we know, digital technology plays a vital role in improving patient experience and outcomes for care. So it's things such as enhancing communication, reducing errors, improving care coordination. So throughout the report, there's multiple references to digital and how this can help improve person-centered care experiences in primary care. One of the key policy recommendations from the Paris report is to enhance person-centered care through investment in user-friendly technology, which will empower patients to play a more active role in their care process. They also talk about improving interoperability of electronic health records to unlock the full potential of digital systems and making health care more efficient and connected, as we all know. So next slide, please. So for the next few slides, these are around digital access. Please bear in mind what Sarah said earlier, that these surveys were submitted in spring 23, so represent the state of play then. So as we know, since then, the NHS Wales app will have done a lot to improve these areas and continue to do so as it's rolled out. So as we can see here, Wales is below the OECD average for patients booking appointments online, with only 25% booking this way. The average was around 54%. Next slide, please. So Wales is also below the average for patients accessing their medical records online, reporting less than 5% here in 2023, although this is low amongst all countries across the OECD, with an average of only 17%. Next slide, please. So when it comes to ordering prescriptions online, Wales is above the average there at nearly 50%. Thank you. Next slide, please. So this looks into digital health literacy. So overall, Wales performs strongly in the report in digital health literacy, with 34% of people with chronic conditions reporting confidence in using health information from the internet, compared to the OECD average of around 19%. However, it has been pulled out on this slide, shows that older and less educated people have trouble accessing this digital health or using this digital health information. So this slide shows the difference in the percentage of people who indicated that they're confident in using the information from the internet to make health decisions, across education groups on the left and age on the right. So the survey shows a significant gap in digital health literacy by both those things, education level and age. And in Wales, the difference is more than 15 percentage points in confidence between those with the higher and lower education levels, and between older and younger age groups. So this represents a dual challenge for communicating essential health information for older and less educated people. Next slide, please. So this is the final slide. So this shows since the work we have been doing since the OECD Paris flagship report in February. So now that's been released, we've begun to explore the wider population data set collected in Wales, gaining insights into this current state of play. So our work includes collaboration with clinical networks and programmes, examining data representativeness and linking the data to the national data sets that we have here within DHCW for further insights. So we've been working with clinical network leads in areas such as pain, diabetes, women's health, neurological conditions, MSK and end of life. And additionally, we have collaborative publications that we're working with and further planned with CEDA, which is the Centre for Healthcare Evaluation, Device Assessment and Research in Cardiff and Vale Health Board. And we've been actively presenting and submitting posters for conferences. Couple shown on the screen. So our collaborative team is committed now to maximising the impact of this novel data set, engaging with clinical networks, Welsh Government, NHS organisations, demonstrating its potential benefits and providing evidence to support improvements in health and care services. And we also hope this data set can help inform DHCW work around promoting health literacy with the NHS Wales app, and provide further evidence for the investment in digital. So thank you for your attention, and we're happy to take any questions you have. Thank you. Thank
you, Sarah and Sally. I saw, well, there we are, back. You disappeared, Rowan. I saw your hand go up, and then you disappeared. But okay, got Rowan, Alistair, and David all would like to ask them. So off you go, Rowan.
So Sally, I've got a specific question and then more a generalised point for you. So the specific question was on digital health literacy, when you spoke about the respondents' confidence with using digital literacy, digital health information from online sources. Was that specific? Was there any specific questions about the sources of that information or ability to assess information? There's a lot of evidence now where the younger generation are using TikTok for their primary health information, and that's obviously quite a wide ecosystem, shall we say?
Yeah, it was purely a question on whether, well, there was two questions, I think, on whether they're able to understand the information provided to them, and whether they're able to access the information provided to them. So this was made up of like an average of those two questions.
So there's a presumption there that you're describing healthcare information that's been provided through a primary health source. Is that
Yes.
correct? Great,
Yeah.
that's really helpful. I suppose my more general point is as follows, really. Worldwide, we spend around 10% of global GDP on healthcare, so that's $10 trillion. In the UK, we're spending a bit more than 10%. 80% of what we spend will be on the treatment of chronic conditions. The UK has a challenge, and globally, actually, we have a challenge in that those healthcare costs are becoming unaffordable because they go up every year by 2 to 3%. And we're all living longer. We're living longer with multiple complex chronic conditions. So, once we're over 65, it costs on average 5 times more to treat people because they're multimorbid, i.e. they have more than one chronic disease, sort of this group that you were surveying. And that means that they're polypharmaceutical. They're taking more than one drug, and there are consequences of taking multiple medicines. And that's why, DHCW have invested in the digital medicines portfolio. With that in mind, it's absolutely crucial that we crack this, because continuing to deliver healthcare as we have always done is just not an option. Doesn't matter whether we want to or that's the right thing to do. It's literally that the knicker elastic won't stretch that far. So with that in mind, you talked about coordination of care. Where are those conversations taking place that are across morbidities? Because there is a tension in the system that we deliver care through clinical experts for very good reason, but the individual patient has multiple diseases, and providing an intelligent and well understood background to guiding them to live their healthy lives requires integrating that. So what are the integrated places for having those sort of multi-morbid care conversations?
Shall I help?
That'd be really helpful, Ridian, because I think it's core to this.
I mean, that's because that's quite there's a lot to unpack in that, Rowan. Thank you for the question. I think if one looks at the report, and I think the executive summary is worthy of review, and page 167. Most people are living longer. It states that since 1970, a great year to be born, people are living 10 years longer. But it makes a real comment, which is something which I think policy leads across Wales have been cited on for some time, and that it's not only a matter of spending more money, but it's about spending more time. And who a patient spends that time with influences their outcome. And the report comments on patients, what they want, those 3 T's, time, they want shorter waiting times, but longer consultations. So they want to be listened to. So that goes in line with what we used to describe as the prudent healthcare principles, the policies that came before a healthier Wales. And they want tailored care, in other words, personalised care, a co-production element of that care. And they want trouble-free care, and that is safer care. Everyone would like that. And actually, those 3 T's are linked to probably the relationship between a patient and the services they use, both the services that they access, but also the people who provide that, which is trust. You need trust in the system to believe the information that you're having. And that's the key element of the sort of doctor-patient relation, but also the wider healthcare community. So if we look at what our ambition is, Choose Pharmacy is a good example. So the ability to help people manage their chronic conditions in the community, the use of centres to support the more elderly population in terms of maintaining social contact, because we know that that's a determinant of health. We also know that social deprivation and income and education are severely linked, and therefore there's an education programme, if we look at policy way before patients are 45, in an attempt to avoid them getting chronic conditions. So if you look at a healthier start, the ambitions to reduce obesity in childhood. So there's a complete policy wrap involved in a wider NHS and a social health care, because we have to consider our social housing position, we have to consider our education position, we have to consider our nutrition position, the public health environment. So there's a lot to that, but this actual survey points out those three things that patients want. They want timely, trusted, available care with health professionals who or advice that is right for them. What I think is interesting about that age difference, I mean, this is patients over 45 that are considered young. If we look at previous comparisons of social deprivation in Wales, we have a significant number of people over 65 with at least 2, if not 3, chronic conditions, and that really impacts your ability to access health. Transport is a very good example. The using of a bus to go to hospital if you've got to make more than one change, people missing appointments, not accessing care. So pushing electronic digital systems that support the delivery of care closer to the home, again, another policy ambition, is a way forward. I think there's lots to learn from this survey.
Alistair.
So thank you, Ridian. I'm just going to one last point, because I think Ridian,
briefly, Rowan, because there's a couple of other people want to come in.
That was a beautiful explanation of the change challenge, because there's lots of pieces there that are around change, and I think that's one of our big challenges at DHCW, to support that change. That's great.
Alistair.
Thank you, Simon. First of all, apologies for being slightly late to the meeting. Sohail, thank you for connecting me. He was like Tom Cruise, and I could hear the IMF music playing in the background as he was linking me up. Took 45 minutes or so. But thank you. And also thank you for the presentation. Very interesting to read, and some that's looking positive, some less so. I just wanted to move into slightly more practical territories, because I completely agree with what we've just been describing, but I'm not sure to what extent we can do a great deal about simply observing the need for us to be more effective as a country in the strategic direction of this work. I just want to point out this issue that came up in the presentation of what I recall, and some of you will be old enough, others you'll say you never knew that, but 20 years ago, we really began to talk about as digital exclusion for older people. 10 years ago, we were all talking about it becoming an embedded problem. And it's this eternal, what seems like an eternal paradox, which is the very people who need so much of the care most are the very people who are in most difficulty in accessing the digital means through which they can actually access care. And, it seems to be an eternal paradox we've been describing. And if I were to describe it this way, I don't think I'll be a million miles wrong here, because I've worked in local authority world. The local authorities tend to plough their field, and the NHS tends to plough its field. And maybe I'm watching too much Jeremy Clarkson with metaphors, but basically we tend to manage our own domain, accessing and contacting on a daily basis those people who are already assessed to be in greatest need of healthcare. So I do wonder how we might move into some practical further development that I know already happens, because in that area of linking up what we do with what local authorities do must be the greatest way to break through that, what appears to be currently still an eternal paradox. But I just wanted to reflect that point. So thank you, Chair.
Okay. And David.
Thanks, Simon. Thanks for the presentation. Really, really insightful. There were two things that bothered me as we were going through it. The first was trust in the healthcare system is quite low, below the average. And when we got to care coordination, I think we were bottom. And I just wondered whether there's any correlation between those, whether people's view of the healthcare system is low because of that lack of coordination, or whether it's actually just about the experience they get when they visit a GP. Have you got any insight on that?
I think the report does touch on trust as a measure, if you want, or a helpful element towards better outcomes and experiences. It doesn't go into particularly the details of why that is, but it does make that connection that actually better trust in the healthcare system does seem to suggest then better outcomes and better experiences. Bear in mind as well, this was collected in 2023, so we were still coming out of the pandemic, so things might be slightly different now. But yeah, I think what this does, it gives us some pointers, and I think it would be interesting to do some further studies and actually understand that those correlation and those linkages a little bit better, and how as a system we can improve that. I think waiting list is probably one element that impacts on trust, and as you know, we're all struggling with that at the moment, but I think there's a lot more perhaps that needs to be said, and taking the point of Alice that some of it may not be to do with health necessarily, but the full health and social care integration as well.
Thank you, Sarah.
Helen, then I've got an observation as well.
Yeah, no, thank you. I just and thank you, Sarah and Sally, for a really great presentation and really clear in terms of the articulation of the findings from it. I just wondered, and I remember the visit I went with Sally Lewis actually to the OECD when kind of this idea was first germinating a number of years ago. But are there other opportunities for us to engage in studies of this kind, do you think?
Yeah, so the OECD Paris is meant to become the equivalent of PISA, for those of you that are familiar with it. So PISA being the sort of cyclical, looking at education. So they intend to have this as a cyclical, but looking at outcomes and experiences of care. Now that will require ministerial approval, and at the moment that we don't have that. The next cycle is projected as data collection in 2027, we then reported in 2029. They're just starting conversation with countries. I believe that some new countries are interested in taking part. Some may not go forward. So I think it's going to be interesting to see how the next 12 months, if you want, develop. But I hope, because of the breadth of information that we get in and the usefulness of it, Wales will take part.
Excellent, thank you, Sarah.
Seems that they name all their studies after European towns or cities with a P. I mean, I'm waiting for Penryn Deirdre report, which would be a good one, wasn't it? I had two observations. I was very interested in the United States, scored very well virtually on every one. I'm not suggesting it was, but you answered this. It did beg a question with me who they were asking. Whether they were asking the well-insured or the non-insured, but I put that to one side. But the one that really interested me, the 3 slides, and I'm going to do this from memory now, you put up in terms of accessing online, which is appointments, records, and medicines. Different countries appeared at the top in each of those. It wasn't a common couple of nations from memory that, like, Holland was top on one, and I can't remember the others. And if we are going to use this data to inform where we are, and those are 3 really key issues for us in terms of the app going forward, and you need to understand whether is that GP choice, is it national strategy, is it funding, or what are the circumstances that put those different issues at the top, the highest percentage of uptake in different countries. So there must be something that is going on, and so for us, for low uptake, low use of appointments would be GP choice. Medicines would be, probably you could argue it was a strategy, and the GPs would. So have we got any way of mining the data to see what is driving the outcome, what is driving the results that help us, that inform us in terms of things like where we go with the app in this case on those 3 particular issues?
Yeah, so obviously from the Wales data sets, we have a much broader data sets that we can analyze further than what the OECD has been able to do on the 7,000. So we got 26,000 or so patients. But the OECD will also release all of the anonymized data sets from all of the countries at some point within the next 12 months. We're expecting it to be sometimes in the probably autumn. So again, that will allow further research to be done and further international comparison. We've also been very lucky to make really good connection with a number of different countries, and there's a real intentions internationally from all the participating countries to work more closely together. For example, I had a call with Portugal just last week because they want to learn from our PROMS strategy and implementation. So I think all of those connections and that we've made will be useful to learn, as I say, what are those key ingredients, what is strategy and what is operational circumstances that make that difference. And then Simon, just to take your first point as well, if you remember the first table with the 10 KPIs, and there were 2 countries right at the bottom. So it's an alphabetical order apart from the 2 at the bottom, which was Italy and the US. And they'd always report it separate because their implementation didn't match anybody else's. So for example, the US didn't survey their GPs. They only looked at Medicare patients. Italy, for example, they only survey from 3 regions, not all of Italy. So again, those 2 countries are always slightly different because methodologically they don't quite align with the rest.
Okay, that's very helpful. So that they're outliers in that sense.
Yeah.
Any other? Oh, Helen, you wanted to come back? Oh, and then Ridian, I was going to come back to you, Ridian, anyway at the end, just to anything you want to add. But Helen.
Yeah, just on that, actually, I guess then, Sarah, there's the opportunity for us to look at triangulating other data internationally with your partners, then to look at clinical outcome data compared to perhaps some of those, well, all of the indicators. But back to Simon's point there about whether kind of digital literacy and analysis, actually, and how we are engaging through digital means, whether there is kind of that I guess any correlation to empowering patients to interact with health services in that way, because it does allow that kind of full participation, doesn't it, in terms of prudent healthcare. But it would be good to kind of keep abreast of what the ideas are for the further analysis, because it's a rich data set that could be joined with other rich data sets. Yeah, no, it's really exciting.
Rowan, you want to come back in?
Yeah, just on that, because Helen, there's the policy piece which Simon touched on in those countries, which will, but the other thing I'd love to see out of this data set is to see whether there is any way of looking at the demographics and finding out whether individuals are essentially living in single person households or have wider family support, because your relations health is often a sort of family activity, and I think that is also quite a powerful lever to understand in terms of people being able to access and coordinate their care.
Yeah, and if I may just briefly come back, sorry, Simon, you're absolutely correct, Rowan, and there are further information. So the questionnaire also asked about support within the family unit, but also support from the wider community as well. So all of that, as I said, it was 122 questions. There's so much information there. We've only scratching the surface of what we can do.
Yes, I mean, if I was handling my father's care, they'd be much better asking me the questions than him, because it was all very smooth for him. Ridian, do you want to come in and oh, where have you gone? You've moved around the screen. Sorry. Do you want to come in and any comments you want to make? And,
so a couple of things. Thank you, Jeff. A couple of things. I'd like to thank Sally and Sarah for taking the time to put that presentation together and generating what is a conversation that no doubt will go on for longer. Just to recap, it's a 285-page document looking at 19 countries. It's based in 2023. When a patient gets 122 questions, one has to question what the dropout rate is, and I think it would be useful, because if you've got a real drive to get that information in there, then you will. Just to defend some things regarding access to GP appointments online, we need to be cognizant of the necessity to triage, so appointments with purpose. So you go to see someone who's the most appropriate healthcare professional to deliver the best outcome for you for the thing that matters to you. And then finally, I just will bring out a couple of things that relate to what we do, Chair, at Digital Healthcare Wales. More than only 17% of patients were able to access their electronic medical records. So our ambition in Digital Healthcare Wales with the NHS app is to give that coded record available to patients so they can take that wherever they go. And that might actually help the movement in terms of healthcare to social care and social care back, and it will empower the patients. And my final point is the sentence that 23% of patients with chronic conditions report having to repeat health information that should have been in their health record. Now, our ambition is to collect everything from every care event, to store it safely and securely, and to share it along the patient journey for safer care. So I think in Wales, we definitely have the ambition, and I think we can do a lot better than some of the stats, and I look forward to the opportunity that we engage in it in the future. Thank you.
Thank you, Rydian, and particularly thank you, Sarah and Sally, for the presentation. You can judge by the conversation and the people engaging in that conversation afterwards how interesting and useful it was. So thank you very much, and please feel free to get on with your day. Okay, moving on then to the part 4 of the agenda and Ruth's vice chair report. There's a few things in my report that I particularly draw your attention to. The bit on the board briefing and what we've done in the board briefing, and particularly the work we've done around since our escalation, and a very useful session that we had, which enabled the board to reflect on the circumstances leading to the escalation and how we would address those issues going forwards to ensure that we were I don't know if de-escalated is the word, or we come out of escalation as soon as is possible. So that was a very useful session, and the board now, I think, have engaged on at least 3 occasions, formal occasions, around escalation and addressing the issues there too. I had a very really useful and informative meeting with the Welsh Clinical Informatics Council meeting. And one of the things I undertook to do there, and I've been discussing with Rydian, is to raise the issue of the clinical voice at the senior strategic all Wales level around digital strategy and implementation. I think those of us who've been involved in the health service over many years recognise the absolute imperative of a clinical voice being at the heart of all strategic and operational decisions for very obvious and very good reasons. So thank you for sorting that out, arranging that, Rydian. Also, draw your attention to the event, which is the Welsh Government, in the form of the Cabinet Secretary, responding to the publication and the recommendations therein of the Ministerial Advisory Group. And it was a report on NHS Wales performance and productivity. And for anyone who hasn't had a look at that, it is worth looking at the report and the Welsh Government response, particularly in the context of the central role that digital is highlighted for digital in improving performance and productivity. And finally, just to say that I had my end of year annual review with the Cabinet Secretary 2 or 3 weeks ago now, and it was a very useful session. Wouldn't be appropriate to go into the detail than to say that it was conducted in a very friendly and constructive way, and he recognises the importance of digital, asked questions about how we felt about escalation, and obviously we've taken a view that is potentially very helpful for us in terms of sorting out responsibilities and roles across the whole wider system. So I think we took that on board, and it was a very amicable discussion, I'm pleased to say. Those are the things that that I'd like to particularly draw out of my report. I don't know, Ruth, if there's anything you'd want to draw out of your report or highlight?
Nothing beyond the report, Simon. Thank you.
You've become a ventriloquist on my screen, Ruth. You managed to, I don't know why you're freezing a little bit, but we heard you. Okay, has anyone got any questions on any of the items in my report or in Ruth's report? If not, I ask you to receive that report. Thank you. And then I'll move on then to item 3.2, the Chief Executive's report, and hand over to Helen.
Diolch, Chair. Colleagues will be aware, and we've mentioned it already, that we have, as an organisation, been placed into level 3 enhanced monitoring as part of the escalation framework. That is being picked up later on the agenda, but just to brief the board that I have, since we last met, appointed Chris Starling as the SRO for that work for us to lead on that agenda, and he will take us through kind of the more detail of where we are with that later on today. You'll also have picked up from Simon's update there that it's been a really busy couple of months. There's been a number of ministerial events. We've had a session on the planning for next winter, a session on Cabinet Secretary priorities, and of course, as Simon just mentioned, the Ministerial Advisory Group's report on performance and productivity. I think the thing to note from all of those really helpful kind of events that brought the leadership of NHS Wales together is the amount of focus on digital and data in all of those conversations in the MAG report and all of the events really. So I think there's a lot for us to do collectively in the but also I think helpful that the opportunities of digital and data are being recognised in that way. And on that note, we've also had the first Digital Data and Technology Leadership Board that took place earlier this month, and it was chaired by the Minister for Health and Wellbeing, Sarah Murphy, who's also got the digital health brief in her portfolio. And that was the inaugural board where we reviewed terms of reference and looked at priority setting and the outline draft governance arrangements. The board followed what was a really successful digital summit hosted by the Minister, where there was a focus on the key priority areas, including connecting care, the NHS Wales app, maternity and mental health, along with the national target architecture, which again we'll hear some more about later on the agenda from Ivan. And then finally, myself and Sam Hall, we gave evidence a couple of weeks ago now with colleagues from Cardiff and Vale on digital eye care as part of the Health and Social Cares Committee short inquiry into ophthalmology services in Wales. So yeah, it's been quite a busy couple of months since we last met as a board, but happy to answer any questions on those or anything else in the report.
Marion.
Diolch Cadeirydd, and I'll speak in Welsh if I may. Diolch Helen am yr adroddiad a braf gweld gymaint o weithgarwch yn digwydd. Gai droi at eitem 4.4. Falch iawn o weld bod ni'n parhau efo'r cyfarfodydd ymgysylltu gyda Bwrdd Iechyd ar hyd a lled Cymru, ac wrth gwrs, ni'n mynd i gael diweddariad ar y cynllun ymgysylltu rhanddeiliad yn ddiweddarach y bore yma. Just cwestiwn, beth yw'r prif negeseuon a'r canfyddiadau sy'n codi allan o'r cyfarfod yna efo Hywel Dda, ac oes yna batrwm falle efo rhai o'r Byrddau Iechyd eraill ydych chi wedi gyfarfod hyd yma?
That's a great question, Marianne. Thank you. They're super helpful meetings, particularly when they're face to face. So we went down to visit Phil Clure and his team to really understand where their digital strategic thinking is at the moment, and what their plans are and where their priorities are. There's quite a lot going on in that space. They've also got the joint committee with Swansea, and there is a joint digital group that sits under that joint committee as well. So the discussions that we had with them was about how do we kind of engage, how do we become kind of a partner with them to actually support the agenda and really kind of join up and align to ensure, and there's an absolute desire through the conversation and through their actions actually in Hywel Dda that they want to move forward hand in glove, if you like, and ensure that they're fully aligned with the national direction of travel. I think the general things that come out from these sessions is that there is a real focus in every organisation on the opportunities for that digital and data bring. There are challenges and risks that needing to be mitigated, particularly in the technology layer, as we know, when there are gaps in functionality that need to be bridged. There is a definite desire to work towards actually providing the tools, include, you know, whether that's digital tools, whether that's the data that supports the information that we need to provide the insight for decision making. So there's a definite desire for that. I think there are differences in approaches, and there's some work that we're doing collectively now across Wales to actually look at the alignment of digital strategies or the differences in digital strategies, and to perhaps have a different conversation about what it is that we could be doing to get greater alignment in that space. I think the new DDAT governance will help to kind of surface and provide the route through for some of those conversations to happen in a way that perhaps they haven't really been happening in that way up to now. But they're really helpful sessions, yeah.
Thank you, Helen. It's good to hear.
Any other questions? No, thank you, Helen. We're asked to receive that report. I'm sure people are happy to do so. If we move then on to the next item, which is the next section of the strategic items, and the first one is the IMTP, the Integrated Medium-Term Plan and Remit Letter, and Ivan, the Executive Director of Strategy, is going to update us. Over to you, Ivan.
Diolch yn fawr iawn, Simon. Felly mae'r papur yn un weddol gryno. Wi jyst yn mynd i ddilyn ni trwy'r papur yn gyflym, ond cyn gwneud hynny, wi jyst eisiau pwysleisio faint o waith sydd yn mynd ymlaen tu cefn y llenni rhwng y tîm cynllunio a tîm y Llywodraeth. Mae Lenny wedi bod yn fwy prysur nag erioed o ran y negodi oherwydd y resymau a welwch chi yn y papur. Felly, ni wedi gweithio'n galed i gadw papur ar bwrdd yn gryno, ond mae hynna, ond dwi'n eisiau unrhyw gan gymryd nad oes na waith dwys iawn yn mynd ymlaen yn y cefndir. Felly mae yna gyfres fel wnaethon ni ddangos yn yr IMTP hun, pam nath y bwrdd gymeradwyo'r IMTP ar ddiwedd mis Mawrth. Ein bwriad ar y pryd oedd ymateb i'r llythyr cylch gorchwyl drwy weithio'n agos iawn gyda'r Llywodraeth mwyn cymharu y disgwyliadau oedd yn y llythyr yn erbyn beth o'n i wedi drafftio yn yr IMTP a wedyn dod i gytundeb gyda'r Llywodraeth ar un set o gerrig milltir a wedyn bod ni'n gallu adrodd yn erbyn hynny. Wy'n falch iawn o ddweud bod y Llywodraeth wedi derbyn hynna fel fframwaith ac ers cychwyn mis Ebrill ni wedi bod yn cyfarfod gyda'r tîm yn y Llywodraeth yn reolaidd mwyn gweithio trwy hynny a ni'n dod tuag at y diwedd y broses. Falle tipyn bach yn hirach na'r disgwyl, bydde wedi cymryd tua 11 wythnos i ni. O'n i wedi gobeithio falle yn agosach at tua 8 wythnos, ond oedd hynna, wy'n meddwl falle yn uchelgeisiol ar ôl i ni fynd mewn i'r gwaith. Felly ni wedi cyfarfod 5 gwaith gyda'r Llywodraeth i gyd, ni wedi cytuno'r fframwaith, ni wedi gweithio oddi ar un teunlen gytun, ganol mis Mai i ni wedi cytuno a bydd na newidiadau wedi rheoli, so change controls, ar yn ochr ni a hefyd ar ochr y Llywodraeth mwyn dod â pethau at ei gilydd, a wy'n credu bod hynny yn dangos cydweithio da iawn a bodlondeb i blygu ar y ddwy ochr, a wy'n croesawu hynny yn fawr iawn. A i ni hefyd wedi llwyddo i dynnu y cerrig milltir sydd yn y cynllun cynllun glanio falle, y cerrig milltir sydd yn dod o'r statws esgynol sydd gyda DHCW escalation status. Ni wedi dod o'r rheini mewn hefyd, felly mae yna 2 elfen yn awr yn hytrach na 2 elfen, ond i ni wedi llwyddo i asio hynna ac cytuno hefyd gyda'r Llywodraeth bod ni'n gallu gwneud hynny. Felly, ni'n gobeithio yn ystod yr wythnosau nesaf erbyn yn ystod mis Mehefin, a byddwn ni'n gallu cytuno set gyfan o newidiadau gyda'r Llywodraeth, byddwn ni'n gallu cadarnhau y newidiadau hynny trwy'n prosesau mewnol ni yn DHCW, bydd y Llywodraeth yn cadarnhau rheini trwy i prosesau newid nhw, a wedyn mi fydd gyda ni gynsail gadarn ar gyfer yr adrodd perfformiad reolaidd sydd yn mynd o fis i fis yn erbyn y cerrig milltir hynny. Felly, wy'n ddiolchgar iawn i'r tîm cynllunio am y gwaith manwl ac agos, a mae fe'n waith manwl iawn gyda nifer o gerrig milltir sydd gyda ni i geisio dod â ni ddiwedd y daith ar hwn a wy'n cymerwyddo'r papur i chi.
Diolch, Ivan. Any questions or comments? No. People happy to note the update? Oh, David. Yep. Off you go, David.
Sorry, Simon, it's a bit slow getting my hand up. Yeah, thanks for the update, Even. If I've understood you correctly, what you're basically saying is we've made really good progress and we hope to be able to close out any major discrepancies and manage it through our change processes by the end of June. Is that correct?
It is, yes. Well, hopefully we're aiming to confirm all of the change controls on our side and on the Welsh Government side so that we have effectively bottomed out the remit letter, the escalation roadmap, and the changes that we need to our IMTP We then have a solid platform on which we can report monthly through IQPD in an integrated way. There will be other change controls through the year, but we'll manage those then through our usual regular change control mechanisms. But we're all on the same page, and it's been a sort of a three-way reconciliation, which is what's made it quite delicate, I suppose.
Okay, lovely, thank you.
Okay, thank you, David. Thank you, Ivan. Any other questions? No. Okay, people. I'm just saying, people have to receive and note the report. Okay, and then we move on to item 5.2, the strategic procurement report, and invite Claire Osmondson-Little, the Director of Finance, to introduce the item. Over to you, Claire.
Diolch yn fawr iawn, Simon, Bwrdd. I have two items of note and for approval from the board this morning. The first of which relates to the year 4 of the Microsoft true-up. This is transacted through our contractor, Trustmark Solutions, and it runs from the 1st of July 2025 until the 30th of June 2026. The value of this contract is 33,460,351 and 5p, excluding VAT. And within that, there is a DHCW element, which is just over 4.6 million. And that is actually because DHCW also acts on behalf of primary care, for example, and includes their licenses within that. So this really is part of a 5-year agreement that we undertook back in May 2022, when we acted on an always basis for the Microsoft Enterprise Agreement. And that agreement gave us discounted prices over a 3-year term, but also increments over a 2-year term. Each of those additional 2 years was split into 12 months durations. The proposal in front of you today represents year 4 of that agreement. And underpinning that, we have had a All Wales Microsoft Enterprise Agreement Task Force that has representations from all the NHS organisations. And each of those organisations has done what is known as a true-up exercise to finalise those numbers for the year. So back in 2021, I actually led the All Wales licensing group that worked on the renewal of the Microsoft Enterprise Agreement. And this agreement is procured through DHCW. So we have one purchase order, and this true-up exercise in front of you today will then be procured by DHCW. So given the value and given that there is an essential to get all of these numbers right, each participating organisation has countersigned a briefing document, which is going to their boards, some of them today. So we've had most, we've got 3 outstanding. And once in receipt of that, we will then procure this on behalf of NHS Wales. So as there was a decision point as to whether to go to the 4th year or re-procure, we actually did a benchmarking exercise and took into account if we went an alternative route through the SPA Crown Commercial Services. And that was actually the agreement in front of you represents highest value for money. And we've also looked within that task force group as how do we get the right mix of licensing requirements in order to get maximum value for money. And I can assure you, board, that we've been through that exercise and each health board has undertaken and contributed well to finding that sweet spot in terms of the commercial requirement. So, so I'm asking the board for approval for the 4th year of this agreement. I also should note, make you aware that we are working on the new agreement with Microsoft. So alongside Sam Lloyd, we have started up a task force. DHCW are leading on that. And we are looking at how, as a national organisation, we can really understand our ask and the mix of licences going forward. But for today, I would ask you to note that and approve that true-up procurement for the Microsoft Enterprise Agreement through Trustmark. So, Simon, I'll pause there.
Yeah, I think so. Let's take that one. Any question, David?
Yeah. Thanks, Claire. I fully support it because it's a true up, which is basically an accounting way of working out our usage across the year. Question really is, what's our direction of travel? So if we were to compare this year with last year, are we making more use of the licenses under this contract, or is it sort of plateaued and we've got to a sort of steady state?
So actually, in some cases, we are seeing an increase. So you'll note that DHCW undertook to extend the licensing numbers out to the optometrists, if I said that correctly. So actually our usage and our contract has increased because we've incorporated other services within that envelope. Generally speaking though, David, I think we are focusing going forward as to looking at the E5 and the F3, for example, is how do we really understand the needs of our users in a way that really tries to enhance our ask for the next contract. So yeah, there is in some areas there's a plateau, but actually in other areas we're seeing increases for the right reasons.
Thank you. Optometrists, I think, is the word you're
Thank you.
trying to get your mind around. No, that seems to be fine. People happy to approve this one? Yes. Okay, lovely. Thank you. Move on to the second one, Claire.
Yes, so this one is 931, which is the virtual application delivery and network load balancing contract through Computer Centre. The term of this one actually comes into being in December, so it's from the 14th of December 2025 until 2028, 13th of December 2028. The value of that, excluding VAT, is £3,347,947.26. And the DHCW ask within that is £2,078,999.43p. As you can see, this is not just for DHCW. So again, we're using our national position here. We would also incorporate into that a number of health boards, and that would include in Iron Bevan, Betsy Cadwallader University Health Board, Cwmtaf and Hywel Dda, who also have an ongoing requirement for this technical equipment. So I'll just tell you a bit of terms of the contract, and then I'm going to hand over to my expert colleague in this space, Sam Lloyd, to talk a bit about what it is that we are asking for in far better terms than I can do. So this contract is for 3 years. It comes into effect in December. There is no option to extend, and I'm looking really for approval to undertake this contract. But before I do, I'll hand over to Sam, who can elaborate a bit more in the process and the requirement that we're asking for today. Thank you, Sam.
Thank you, Claire. So this contract is for the provision of a particular, well, 2 particular services. The virtual application delivery is a tool that enables us to provide the software that we write and operate out to health boards in the most effective manner. So it's a way of basically optimizing the way that desktop software performs. And the network load balancing aspect of it is a way of improving the resilience of our systems by making sure that we can balance services across data centers and regions so that failover can happen automatically between instances of servers. The application delivery one is particularly important for major products like WPAS and LIMS. It's used extensively across those systems. And we've spoken in board before, I think, about how market forces have been driving digital inflation across the enterprise software landscape over the last couple of years. And this was an instance of where we were exposed to particular risk. You know, some of the indicative pricing that we'd had was concerning. But I think this is a success story for us because by undertaking an open procurement and fully testing the market, we've actually been able to come back with and secure advantageous pricing and mitigate one of our strategic cost risks. So this is a good outcome for us and for the whole of NHS Wales, actually, because as Claire says, this software is widely used across the health boards and the costs are apportioned to consumers as well. Thank you.
I assume then, Claire, that also contributes to our non-recurrent recurrent cost savings target.
We'll come up to that in our finance review, but yes.
Alistair and then Ruth.
Yes, thanks, Simon, and thanks for outlining this. I support it. That's not really my question. My question is that on a contract by contract basis, it's actually quite easy to say, look, this is the right thing to do, and it makes sense. It really is just a check as much as anything that this fits our forward procurement plan in the round, such that this isn't another thing that we're procuring and that looks important on a one-off basis, but it actually fits that broader strategic procurement plan. If you could just reassure me on that, I'd be grateful. Thank you.
Yeah, so that really links to Simon's point, isn't it? That we're not building up here additional recurrent finance requirements as a result of the procurement. No, this is not the case in this one, but equally, Julie Francis in the commercial team now presents to the management board every month a review of our procurement pipeline. So we are looking at that pipeline, and in light of our Building the Future strategy, we're looking at how can we reduce the number of suppliers and be more efficient in the way that we procure things, that actually, and buy the right tools to enable us to get that future architecture in place far more cost effectively. So this is part of that exercise that we're doing alongside it, Alistair.
Thank you, Claire. Did Claire's sound drop out for everyone? Okay, it's just that's my problem again. Okay, Ruth, over to you.
Thanks, Simon. Thanks, Claire and Sam. I think from the perspective of value of money, this seems like it is good value for money for us to work in this more efficient way. So my question is, we've got 5 health boards who are joining us and are receiving some specific benefit from this contract. But what about the other 3? If it represents good value for money for us and the 5 health boards that within this contract currently, is the opposite true? It's bad value for money for the others who are going their own way. How do we bring that in if we're thinking about the future and extending benefits from this contract?
Yeah, that's a great question. And this one was, I think the work that Sam Lloyd is doing through the Directors of Digital is actually highlighting opportunities like this as to acting more as a collective in the marketplace rather than individuals. I think in this case, and I'll refer to Sam, the other health boards didn't necessarily need this technology as much as the others, so they didn't have as much of an invested interest. But we are looking more broadly now alongside the Directors of Digital to really try and exploit our national position in the marketplace. But there are, inevitably there are sometimes challenges within that of acting as one team, and we're trying to work on that.
Sam, did you want to pick up a little bit or on the non-usage by some?
I think Claire's covered it really. I think it's not used exclusively. It's not used by everybody across the system. So those that are using it are involved in this procurement.
Great, lovely. Any other questions? No. Happy to approve this procurement. They either have or are going through the Welsh Government approval process. Are they?
Yes,
Great.
they are.
Okay.
Yeah.
Okay, lovely. We're a little bit ahead of time, but we'll break now. And can I suggest we reconvene at 11:20, so slightly more than 10-minute break. And if people could, as usual, turn off their cameras and mute, that would be great. See you at 11:20. Thank you. Just before we start, Alistair, I don't want to suggest you do anything about it because I know it took you a long time to get through, but your background is the old background.
Sorry.
But you may not want to do anything about it given how fragile your connection was.
Yeah, it might be wise to hold on. I'll have a look while we're doing it, but if it means putting anything at risk, I won't.
No, I wouldn't. I just thought I'd point it out for next time.
Yeah, thank you.
I am here, Chair. I just can't get my video to work now. So I'll try and fix it.
Okay, croeso nôl pawb. Welcome back, everyone. Let's move straight into the next item, 5.3, the Stakeholder Engagement Plan Update, and invite Ifan Evans to introduce the item. Ifan.
Diolch yn fawr iawn, Simon. Mae'n bleser mawr gyda fi I roi adroddiad cynnydd i'r bwrdd ar y gwaith gyda rhanddeiliad. Wy'n gwybod bod y bwrdd wedi cymryd diddordeb mawr yn hyn, a mae hwn yn rhan o'r cynllun o roi diweddariad bob 6 mis. Fel cefndir yn gyflym, tua blwyddyn yn ôl, mi wnaethon ni gomisiynu Atos I wneud arolwg annibynnol o gysylltu gyda'r rhanddeiliad mwyn adnabod unrhyw broblemau, adnabod bod yna lle I weca. A allan o hwnnw ddaeth 27 argymhelliad ar draws 6 thema gwahanol. Yn yr hydre, mi wnaeth y tîm gymryd yr argymhellion hynny I trosi nhw I gynllun gweithredu llawn, gyda pwyslais weddol byr dymor dros flwyddyn. Felly ni'n anelu y gwaith at y flwyddyn 2025, 75 o weithrediadau, a ni hefyd wedi recrwtio aelod ychwanegol i'r tîm. Ni wedi sefydlu grwpiau cyflawni mewnol a draws DHCW a hefyd cynllun cyfathrebu mewnol a I ni yn adrodd yn reolaidd i'r bwrdd bob 6 mis, a mae hwn yn un o'r adroddiadau hynny. Weithiau adrodd ar gynnydd yn gyntaf, mae 15 o'r 75 o'r gweithrediadau hynny wedi cwblhau yn barod. Mae 39 arall ar waith. I ni'n sgorio nhw gyd, coch, amber a gwyrdd. Mae'r papur yn dangos dros 70% o rhai ni wedi'n meddwl yn wyrdd ar hyn o bryd. Ni wedi cyfarfod yn rheolaidd gyda'r grŵp cyfarwyddwyr digidol, achos mae yna 11 o weithrediadau yn y cynllun sydd yn rhai i'r system gyfan I weithio ar y cyd, nid I DHCW yn benodol. A mae'r cynllun gweithredu hynny dros ben y gwaith cyfathrebu a ymgysylltu arferol I ni'n gwneud ar draws y sefydliad. Mae Helen wedi sôn am y gwaith I ni'n gwneud gyda tîmoedd gweithredol, rhai o'r byrddau iechyd. Ni'n cyfarfod gyda arweinwyr y Llywodraeth yn ffurfiol ac yn anffurfiol yn rheolaidd iawn, a o ran gwasanaethau ni'n darparu ar byrddau rheoli gwasanaethau a hefyd y rhaglenni cydweithredol I ni yn darparu I ni allan yna yn cyfarfod gyda'n rhanddeiliad ni drwy'r amser. Felly mae'r cynllun gweithredol a'r cynnydd yn erbyn y cynllun hynny yn ychwanegol i'r gwaith I ni'n gwneud o ddydd I ddydd yn rheolaidd fel arfer. A wedyn, yn olaf, wy jyst eisiau edrych ymlaen, felly y ffocws am y cyfnod nesaf bydd y gweithredu system gyfan yna sydd gyda ni, a yn arbennig cytuno ar y rôl a cyfrifoldeb pob sefydliad. Mae hyn yn mynd gyda gwaith mae'r Llywodraeth yn gwneud yn newid llywodraethiant ar y lefel genedlaethol. Mi nath y cyfarfod y DDAT Leadership Board, sef bwrdd arweinyddiaeth DDAT cyntaf gyfarfod dechrau mis Mai, a ni hefyd yn ychwanegol I hynny yn sefydlu grŵp rhanddeiliad allanol bydd yn cyfarfod y mis Mehefin am y tro cyntaf. Mwyn bod ni'n gallu cael golwg ar y pethau hynny fedrwn ni ddim ond gwneud gyda cydweithrediad pawb arall ar draws y system, yr holl cyrff eraill yn yr NHS a hefyd y Llywodraeth. Felly, we're hapus iawn gyda'r cynnydd mae'r tîm wedi gwneud. Mae yna dyn peint sy'n arwain y tîm, a'r tîm sydd gyda hi yn gwneud job da iawn, wy'n credu, o roi patrwm a siap ar y gwaith hyn. Mae aelodau staff ar draws y sefydliad cyfan allan yna yn gweithio'n agos iawn gyda'n partneriaid a'n rhanddeiliad ni o ddydd i ddydd, a wy'n hapus i gyflwyno'r papur i chi.
Diolch, Ifan. Marion.
Diolch yn fawr Ifan am y diweddariad yna ac braf iawn clywed bod ni ar y trywydd iawn i gyflawni y camau gweithredu. Am wn i, mae cwestiwn penodol sgynna i ynglyn â effaith yr holl weithgarwch ar ymgysylltu yma. Alli di atgoffa ni fel bwrdd sut i ni'n mynd i fesur effaith y cynllun ymgysylltu yma yn y pen draw? A beth yn ni'n gobeithio i gael allan ohono fo?
Ie, wy'n credu bod hwnna'n gwestiwn da iawn. Marian, ti ar dan heddiw gyda cwestiynau treiddgar. Y bwriad yw i fynd nôl i ofyn cwestiynau sydd ar yr un ffurf a'r un siap a rhai nath Atos wneud i ni llynedd mwyn gweld os i ni wedi symud. Beth wnaethon ni wneud oedd gofyn i'n rhanddeiliad sut i chi'n teimlo am y berthynas, beth i chi'n meddwl gallen ni wneud i wella y berthynas, sut mae gwella pethau. Mae'r cynllun gweithredu yn ymateb yn uniongyrchol a mewn ffordd glir iawn i hynny. Yn Saesneg, you said, we did, byddwn ni'n mynd nôl at. A wedyn cawn ni weld os ydy'r nedwydd wedi symud pan mynd ni'n dod nôl at i flwyddyn nesaf. Ni'n gobeithio'n fawr fydd e wedi. Os yw e heb, wedyn bydd sy'n ni edrych ar ddulliau gweithredu arall neu ffordd arall o ddod ati mwyn gwella, achos fel bydd aelodau'n gwybod, mae amcan 5 yn ein cynllun i gyd am ddatblygu ffydd a hyder ac ymddiriediaeth ein rhanddeiliad. Hebddyn nhw, fedrwn ni ddim gweithredu yn effeithiol. Felly, ni'n benderfynol o wella'r sefyllfa. Mae'n teimlo fel bod pethau yn gwella. Ond allai ddim mynd pellach na dweud bod e'n teimlo fel bod ni ar y trywydd cywir ar hyn o bryd, achos dydyn ni ddim wedi dod nôl i fesur yn ffurfiol.
Diolch Ifan.
David.
Thanks, Simon. Thanks for that update, Ifan. There's a lot of great work being done in this space, so I commend the work we're doing and thank the team for it. The one thing that you mentioned, I think will help us going forward is the focus around the roles and clarity in the wider system, particularly by Welsh Government and the new DDAT Leadership Board, which I think will help this stakeholder engagement going forward. My only concern is how long is that going to take? Because it's something I think has led to the position we benchmark with Atos. Once that's settled, I think it'll be a lot easier for us to do what you're trying to do in this space. So have you got a feel for the timescales around that playing out? I know that's how long is a bit of string type question, but I'm just trying to get your sense. Are we talking a couple of quarters or are we talking 18 months?
Oh, well, that I was thinking I would find it very difficult to answer the question, but a couple of quarters rather than 18 months.
Okay.
So as you can imagine, government is leading on that. Helen referred earlier to several different summits. There was a cabinet summit, cabinet secretary summit. Then there was the the ministerial advisory group on performance. Then there was the digital summit led by the minister. The messaging is, in fact, I think it's really pleasing to see how visible and prominent digital has been in all of those conversations, and clarifying roles and responsibilities has been a consistent theme of that. The DDAT Leadership Board is on a monthly cadence. It's sort of being established from the top down. But I would say that landing those roles and responsibilities is absolutely squarely in the scope of that work. So yeah, over the next few months is our expectation. There has been some turnover in the digital policy team. So it's a little bit under strength at the moment, and we've been saturating it a little bit with the work that we've been doing on the milestones and the remit letter and escalation and a variety of other things. But these governance matters, I think, you know, there's a strong consensus that it's really needed. I can't currently say how easy it's going to be to land roles and responsibilities amongst all the different partners and stakeholder perspectives that we have across the system.
Okay, thanks.
Claire and then Helen.
Yeah, I just wanted to come back on Marion's questions, which I thought was a cracking one, and just promote our new performance report, where we are trying to capture and measure the stakeholder aspect as part of a balanced scorecard, which you'll see a bit later in the board. I think it's very difficult sometimes to get the right measures in order to sense that, and very often you can't measure the sense of stakeholder engagement, because it does really come down to meetings and collaboration. But I do sense that the work that Nadine's doing, alongside the work that we're doing as part of building our future, and some of the context now after the MAG report, that there is an appetite to maximise the potential of digital, and that means that we've got to grab each other's hands and work harder at it. So there is great work that Evan is leading alongside Nadine, but we are trying to capture that and measure it in appropriate settings in the appropriate way. But we've got some way to go, obviously, to do that. But just thought I'd raise that point. Thanks.
Thanks, Claire. Helen.
Yeah, thank you. Just picking up on David's question, actually, and in line with what Evan has said, I know that the digital team are actively working now on the suggested boards that would feed up to the DDAT leadership board that is co-chaired by the Minister for Health and Mental Health and Wellbeing and the DG Julie Paget. So I would imagine that we would see over the coming few months a number of these boards come into fruition, and to kind of walk through now examples of the areas that we'd want to focus on in terms of that leadership board, whether that's for decision, whether that's for kind of, you know, collaboration and awareness, really to start to see it step into that operation phase, really. And I think part of in the first board, there is a draft kind of view of the Once for Wales definition, and it's a tiered approach. I think we'll start to see perhaps some examples of major initiatives perhaps being taken through that, and to see how that needs to work and operate within a framework, if you like, so that we get some consistency around that. So it feels like we're moving forward in the right direction, David. So hopefully soon we'll see the other boards come into fruition.
Great, thank you for that context, Helen.
Thank you. Just even a couple of observations. I mean, I know it's almost impossible to produce a complete list, but there's a couple of other things, so which you might want to include in terms of building our stakeholder engagement, is the briefing that Helen and I are now doing for chairs and chief executives, which is going out on about a 6-weekly cycle, isn't it, Chris? It's something like that, 6-weekly cycle. And the other one, which may well be caught up in one of the bullet points, is the webinar series, the webinar program that we've now introduced, which the first one was on the NDR, the second one I can't remember what it's on. So that I think there's a bit more color you could put in the report in the future, because there's more and more stakeholder engagement initiatives coming on stream, which is part of the plan, isn't it? And I think the first webinar had the best part of 100 people involved. So they're obviously hitting a sweet spot as well. Okay. Any other? No, nothing you want to come back on, Ivan? Great.
No, thank you very much.
If then we agree to receive that report, which I'm sure we're happy to do, when we move on to the second of the updates, which is update on our Building Our Future programme, and Claire Osmondson-Little, Exec Director of Finance, is going to introduce that item. Over to you, Claire.
Thank you, Chair. So I've got a couple of slides, you know me, but actually since the report has been written, I have had the opportunity, as part of the request of the remit letter, to share our Building Our Future programme case, for want of a better word, with Welsh Government, and the response was really supportive. There was a few observations and next steps, but actually it was a great session, and it was lovely to share some of the great work that we're doing at DHCW. And since we've met, we've had 2 programme board meetings, both of which have been really productive, and the focus has really been on getting the new organisation into place. And we are looking alongside our partners with staff side and key groups to see ways in which we can accelerate some of the changes that we would like to make, which is really great. So I've got a couple of slides to go through and I'll whiz through them. So if we move to the next slide. Just a bit of a reminder then that obviously as part of the programme, we've centred it around the 5 key principles in our strategy. And obviously our purpose is to really make digital a force for good in health and care. And within that, we've got some key projects, which is really about putting people first and getting our organisational structure, our future space, which is coming on well, and our digital learning portal in place to really equip and organise ourselves and our workforce teams to deliver our future. We're looking at enterprise tooling, looking at financial efficiencies and the importance of adopting AI. We're also looking at relationships, so we just had that conversation around that. Organisational improvements, we've got some interesting work on that, and obviously service improvement. So that's what the programme is about. So if you move to the next slide, which is really about putting our people first. So what is happening in that space? So we've been trying to describe what our new target operating model looks like. And we've done quite a comprehensive engagement across DHCW, its staff at all levels, to really position it and get the right words that resonate with people in the right way, so that we can really advertise it at our staff conference in June. So I'll come on to that in a minute because it's on the next slide. We've been doing lots of great work to really update all our job descriptions and ensure that they reflect the new GDAT requirements and qualities that we need, and a great progress on that to date. And we've also been, well, we had put primary care and mental health on hold as a result of the work with IMPS, but actually we restarted and we're raring to go now. And in the last board, we had a presentation on a learning portal. But again, we're trying to find that landing page that enables our staff to self-organise themselves and understand what tools and support we can give them in developing their skill set. And the financial model is underway, and that was part of the presentation that I made to Welsh Government last week. So if we move to the next slide, this really then shows us what the new operating model means in ways that I hope resonates more effectively. We did have a lot of circles at one point and a lot of noise, but we've distilled that into what we at DHCW think it means in terms of putting people first, which is really about becoming a product and service-led organisation, being user-centred, being more collaborative and supporting, and being supported for career development, finding formalities, really improving our processes, becoming financially sustainable, being agile and driving that value, but importantly, social value. We're going to embrace the future, and we'll do that because we're a learning organisation, and we're really going to embed that improvement culture. We're simplifying things by standardising the way that we deliver our programmes, but equally, we're going to provide a toolkit that enables us to do that more effectively and more digital and more data. Well, the exciting thing there is all around the adoption of AI and obviously the hard work that's underway in transitioning to our cloud. So we've really tried to visualise and simplify what it actually means, and obviously we'll be really advertising that in the forthcoming staff conference. So simplifying everything we do, we took the stakeholder plan is going well. We've just touched on that. We've implemented a new 5-minute improvement, which is really starting to drive that learning improvement culture. And again, the social value we've presented at a recent conference, but we're also developing our objectives, which will really underpin the future and well-being's action plan for DHCW. If you move on to the next slide. In terms of finding more value, we've been doing some discovery work in terms of our tooling strategy. Some progress there, but we are now pulling that together, and we've put a team around it to really try and accelerate some of the procurement around the tooling. And again, more digital, more data. We've developed a value model for primary care and mental health. The AI champions have been identified, and obviously we've got a hackathon, and actually we're looking at our co-pilot strategy going forward. So what's coming up in the next quarter, which is the next slide. So we're going to continue with the organisational change plans. And like I alluded to at the beginning, we've had recent boards to see how we can do that more effectively and more quickly alongside our staff. We've obviously got to get all our job descriptions and matching underway, and we've got to procure our digital learning portal. The enterprise tooling, we've really got to list and start our procurement for our key requirements in that. Our comms is going well. We're excited by our slot in the staff conference, and watch this space. Sign up for it if you haven't. And social value, that's really about really pushing the Future and Generations Act and embedding it within DHCW. In terms of finance efficiency, we've done quite a lot of work to define value and capture and measure that. And again, we've got a comprehensive tool to do that, and that's really part of our savings plans, embedded in our savings plans going forward. So if you move to the next slide, that just gives you a flavour of what we've been doing and where the activity's being undertaken. We have a timeline and a plan to deliver towards the end of the year, and yeah, progress is going well. So I will end there, and if you drop the slides, and happy to take any comments or questions.
Lovely, thank you, Claire. Any questions or comments on the progress report? David?
Yeah, thanks, Simon. Thanks for that update, Claire. Lots of great stuff being done here. I'm encouraged by all the work that's going on around people and culture and making this a really great place to work, which I'm hoping will mean we can attract more people into the organisation. But as you know, we've got a little bit of a gap between what we would like in terms of headcount and the number we've actually got. I'm hopeful that what we're doing in this space is going to help, but I'm just have a nagging suspicion that our inability maybe to offer competitive salaries with some of the other big players in this space is always going to be against us. So have you got a view on, is this the magic bullet that will help, or is it just you know, a challenge that we'll struggle with going forward?
Yeah, so we are competing in a competitive market. You know, we have skills, and we can nurture skills that are essential in a digital environment and a digital era which we find ourselves. So I think, well, I believe actually, David, that DHCW can give you that career development to nurture those skills. And we'd like to hold on to you as much as we can, but inevitably in a competitive market, that's going to be challenging. But also, not everybody works for the money. It's really important. Yes. It's a real key driver. And I think that purpose of making digital a force for good in health and care, if we can, through our user-centered design, really bring that into the workplace. I mean, Sam Hall does it for a granny's new knee. She always brings that one up. But we all have a motive, what drives us and makes us stay within an organisation. So I think it's challenging. There are gaps that we are finding hard to fill. Our philosophy is, through building our future, we will give you that pathway and the support to develop those skills. And I just hope we can keep on with them, because the services that we provide motivates them to stay. But yeah, it's like every organisation, actually it's the culture bit that makes you want to stay, because you've got a working environment that enables you to thrive, and that's what Building Our Future is really trying to achieve.
I'm encouraged by that. Thanks, Claire.
Alistair.
Yeah, it's very much, thank you, Chair, and it's very much related to that. Maybe more for Sam Sam Morgan to come in on this one, but just interested, Claire, in how our stability of workforce, the turnover of workforce is just now, and whether that is trending in a direction we'd rather not see, or whether we're happy with it. Because building on the discussion you've just had with David, stability of workforce such that you can develop the knowledge and experience and pass it on is clearly an important aspect of our people and culture. But we're almost making the assumption, I know we're not, but we're almost making the assumption in our declared areas of focus. Thank you.
And if you look at our new performance report, another quote, you'll see that actually you're right, our turnover is slightly up compared to where it's been. It's still very low compared to anywhere else in the industry. I think we recognise that any change programme and uncertainty is not helpful in an organisation because everybody likes certainty. The challenge in the programme has been how quick can we speed up the move to the new organisation and provide people with their new job descriptions and their new positions in a more and provide more certainty. And that's certainly the action that we've taken in the last two boards, is to try and shorten that time frame alongside Sam Morgan's team and also alongside staff side. I mean, to be fair, Andrew Fletcher and Paul Evans have played a really supportive role along with their teams to work out how best to do that in a supportive way. So yes, turnover is slightly up. If you look at the performance report, it's still very low compared to the industry standard. And actually, as a programme, we have a responsibility to manage this in the most effective way. And we're trying very hard to do that within the constraints that we have to work in.
You, Sam Morgan.
Yes, thank you, Chair. So just to echo what's been said, but also to recognise that culture is probably going to be our differentiator in terms of attraction of people and retention of people. So really important that we do focus on creating a really great employee experience. And I think there's lots of really great examples of how we're doing that across the organisation. There's going to be a big focus on culture, and I'll be bringing a paper to board in July around this. But that is our unique selling point. It is undoubtedly a really competitive market, and we can't offer the same salaries that other companies can offer. But we absolutely have to focus on culture as being a unique selling point. And what we are seeing is that we are having lots of people applying to DHCW, so the indicators are really strong. We had around 9,000 applications for our jobs over the last 12 months. So that tells you that people are attracted to our organisation. But yes, we're not being complacent, and we want to ensure that we really maximise the culture that we can offer our staff. So thank you.
Chair, if I may, just very, very quickly, and I've mentioned previously the changes that are happening at the NHS in Whitehall might free up some highly skilled people who might well be interested in what we can offer. So it's just to indicate that one again. But thank you.
Yeah.
Okay, thank you. Sam Lloyd.
Thank you, Chair. Some of my points have actually been made, but I think, as somebody who's done a lot of recruitment over the last couple of years, I think we are attracting and retaining really high quality, mission driven people into DHCW. So I think bringing the people in is not the challenge. I think the challenge that we have got at the moment is that we're asking a lot of people. There's a high volume of change within the organisation at the moment. There's a significant demand of work on top of that. And so, the challenge that we've got and the one that we're tackling through building our future is that we need to take our people on the journey with us and make sure that we retain the people that we're attracting. So, that's I think the challenge that we're rising to, and we've got opportunities through building our future and also through other big transformation programs like the cloud migration to make sure that we're baking that transition of people into the work. So it's not a transition of technology, it's about how do we bring our people with us as we move our capability from one way of doing things to another way of doing things. The technology is just that's the methods of delivery, but it's the people and the capability that's really important.
Thank you, Sam. Rowan.
Just building on what Sam has said and referencing Claire talking about the performance report that's been improved. I'm just wondering whether there's been any discussion of metrics, beyond the recruitment of talent in and the number of vacancies, but looking at, how many of our or what proportion of the workforce has, had developed skills and what level of skills gap are within the organisation and how we plan to close that. So I'd be really interested in sort of what discussions have been had within the exec team on those thoughts, because the in-out measurement is obviously fairly easy, but may not be sort of necessarily the thing that that we should be focused on as a board?
So I can see a lot of my team put their hands up, but
Yeah.
in that, what I would say is that's really what the digital portal will enable us to do, actually, is have more visibility in more granularity data in the new DDAT framework of where our skill sits and how we can develop that talent pipeline and keep them engaged. I think the other part of that, Rowan, is it's also about well-being, that, you know, while we're here, we create a culture that enables us to do our jobs well, because we're well and healthy. And I think the staff survey results have indicated where there are areas that we do need to focus on going forward to enhance that and improve that. And we as execs had quite a good conversation a couple of weeks ago. We're going to launch something which is called What Matters to You, which is looking at, from a well-being perspective, what are the things, or from a work perspective, what are the things that matter to you that we could change to improve the working environment. So a couple of us are going to trial that and see if that's a way of actually trying to enhance what we're doing going forward and really pinpoint those things that matter to people that are going to help retain them and develop them, so that we all benefit from it, quite frankly. So yeah.
Thank you, Claire. Helen.
Yeah, thank you. Thank you, everyone. Actually, kind of echo what's been said to date. I guess the bit around the skills development, we know that is a key aspect of the, you know, implementation of the new organisational design that we're on this journey of, and building our future. That's central to the Building Our Future programme of work. This is really about stepping up our approach to strategic workforce planning. So we're really understanding what is it that we've got in terms of demand, and what does that translate into in terms of the skills and experience that we need in the workforce to actually be effective and be successful. That the learning portal will be the method that will provide the tool, if you like, to each individual in the organisation to actually be able to have a view of what's the skills that are expected for the role that they're in, and how that aligns and reflects the government digital and data kind of as an industry standard in the public sector framework, but also empowers staff to look at what are the other skills that they'd need to actually think about how they map their career going forward in a way that I'm old school, and I've been around for too long now, but I think it would be so empowering to be able to understand where the skills focus can be. So it gives that framework and brings it to life for me. So I think that's going to be quite key in this. And I know Sam is going to come in now, where Sam has been, moving ahead in this kind of redesign in adoption or implementation of the product operating model. You can see people flourish and respond to it. So, but I think translating that then into key metrics is absolutely something, because turnover is helpful and really helpful, and we need to keep track of it. But we're recruiting less. We have less demand at the moment, and we've been growing quite significantly over the last few years. So inevitably, we're going to see an increase, aren't we? That's just simple sums, really, in terms of the actual measure. But looking at the staff survey, as Claire has said, in terms of those metrics, there's some things in there for us to pick up on around staff feeling they can access development in that way. So there are things that are already in place that we could look at in terms of tracking, but I think there are some others that we'll need to develop as part of this.
Sam Hall.
Thanks, Chair. Yeah, just to echo, but actually some kind of put that into real life on what's actually going on the ground now. So as we're making that transition and moving into some of the GDAD roles, we're spotting people who are career adjacent to some of those real specialisms that you need in that modern digital organisation. And so it's not a huge leap for them to actually become accredited and certified in those things that will give them that real boost to their profession and their career. And obviously that's something that we would massively want to do. It's we're a health organisation, and people have got brilliant careers and qualifications in that health sphere because that's where they come from. But we're a digital health organisation, and so having that
having your career and your profession recognised for being a digital expert is really important. It's important for keeping people here, and it's important for attracting people. But we do have a lot of raw materials. People have done some of those really kind of gnarly digital roles, the service design roles, really complex in any organization. Put that in health, doubly complex. We've got people that have been chewing some of that for a long time. Now we're giving them the tools to do that properly, putting them on training courses, giving them a community of practice that they can work with, that they can share their experiences with, bringing in some people who are seasoned in that space that they can go to, who can lead those communities, and they can say, well, this is a real problem. I've hit a blocker. How do I get around it? What do I need? What are the levers for me here? You start to see people really flourish then and bring that in, bring that kind of new world working. The other thing that I think is really starting to see or reap rewards, I'm definitely seeing it in my team, is working in the open. A massive thing in digital. But when you work in the open, you build trust with the people that you work with, because they can see what you're doing and they can see your incremental delivery. They can see you're on it and you're working on it. But it also gives a boost to the people that are doing that work, because it means every fortnight someone is saying to them, oh, that new feature has come on board, or, oh, you're thinking of doing it that way. That's really good. I'll give you some feedback on that. Instead of how they're used to working, which is they might not get feedback for months on something they're working on. So keeping people engaged, keeping them really close to the users in that way, I think that is a massive benefit for us. That working in the open, huge, powerful tool in the digital world.
Thank you, Sam. Rowan.
One last point, if I may, Simon. I think Sam, that is fantastic to hear, and I just wanted to reflect that these are very valuable skills that we're developing. We may not be able to retain those people, and may leave the organisation with really fond memories of their time at DHCW, which is always positive, and go on and secure really high-paying roles in other organisations. I don't think we should be afraid of that, because I remember when DHCW was established, one of the expectations for the organisation is that we actually drive some wealth creation, some economic outputs from having this core ability within the Welsh NHS, and we did start this meeting because of the thoughtfulness of Rydian, with making that point that lack of economic opportunities does have an impact on health. So I think we're kind of living that opportunity within the organisation, and it may well eventually move outside the organisation. And in the right situation, that's a good thing, not just a negative.
Okay, thank you, Rowan. Okay, I think that's okay. We've been asked to note the update, and thank you very much, Claire, for that update and the progress that you've outlined in the program. If we move on then to the last item in this particular section, which is an update on national target architecture, and I'll hand over to Ifan Evans to lead off on this. Ifan, over to you.
Diolch yn fawr iawn, Simon. So wy'n hapus iawn i roi diweddariad ar y gwaith ar yr pensaerniaeth darged genedlaethol. Mae hwn yn waith sydd yn bwysig iawn i ni yn DHCW, bwysig iawn i'r gweinidog, a wy'n meddwl yn bwysig iawn i'r system yn genedlaethol. Mae hynna wedi cael ei gydnabod trwy'n gwaith cyfathrebu a cysylltu, a na i sôn tipyn bach am hynny. Ond yn gyntaf, jyst i adrodd ar cynnydd ar y lefel ucha, sef bod ni wedi derbyn cadarnhad cyllid oddi wrth y Llywodraeth ar gyfer y flwyddyn 25-26, sydd yn meddwl am y tro cyntaf nawr bod gyda ni'r arian i fedru cyflymu ac i wneud y gwaith. Wi eisiau diolch i'r tîm sydd wedi gweithio trwy 24-25, arbennig gwaith beunyddiol nhw, ac yn arbennig Chris Collis yn prif bensaer digidol, a Rhian Rice sydd wedi bod yn arwen y gwaith hyn ochr yn ochr ar gwaith mae hi wedi bod yn gwneud ar bensaerniaeth yn y maes moddion ac ar y rhaglen moddion. Erbyn hyn, mae gyda ni tîm prosiect yn ei le, Mae 'da ni'r tîm penseri yn ei le, mae 'da ni'r cyllid yn ei le, felly ni'n barod i fynd a ni'n mynd i gyflymu yn sylweddol. Ni yn gweithio yn genedlaethol, ni'n cyfathrebu ac yn cysylltu yn wythnosol gyda Llywodraeth Cymru ac yn fusol gyda'r grŵp cyfarwyddwyr digidol o'r Bwrdd Iechyd i gyd. Oedd Helen wedi cyflwyno ar y bensaerniaeth yn y Digital Summit dechrau fis Mai o flaen y gweinidog, a mi nes i a Helen gyflwyno i bwrdd rheoli NHS Cymru wythnos yn ôl, dwi'n meddwl, wythnos diwethaf. A ni hefyd wedi gweld cefnogaeth i'r gwaith yma yn ymateb y Llywodraeth i'r grŵp cyngor a'r berfformiad y Sloman Review gafodd ei gyhoeddi ddiwedd mis Ebrill. Felly mae yna momentum sylweddol tu cefn i hwn. Ar ail agwedd o'r gwaith cenedlaethol yw'r ochr dechnegol o weithio'n genedlaethol, felly ni wedi yn DHCW bwrcasu ar ran NHS Cymru offer o'r enw ADOC sydd yn offer safonol ar gyfer gwaith pensaernïol, fel bod pawb yn gwneud y gwaith hynny ar yr un llwyfan yn hytrach nag ar nifer o llwyfannau a defnyddio offer gwahanol. Felly, beth yw'r gwaith sydd yn mynd i gael ei gyflymu? Mae tair elfen i'r gwaith dros yr haf. Y cyntaf yw asesu cyflwr presennol y bensaerniaeth digidol sydd gyda ni ar draws NHS Cymru, yn benodol asesu'r gwaith hynny gan ddefnyddio ARDOC fel bod ni yn mapio pob peth, bod bob sefydliad, DHCW a'r Bwrdd Iechyd i gyd yn mapio'r gwaith hynny i gyd mewn i'r un offeryn. Wedyn byddwn ni, neu ochr yn ochr a dweud y gwir, byddwn ni yn gwneud gwaith cynllunio a cytuno ar cyflwr targed, so lle ni eisiau cyrraedd, a wedi gwneud hynny, mi fyddwn ni'n gallu cynllunio a chytuno gyda Bwrdd Iechyd a gyda Llywodraeth. Beth yw'r llwybrau trawsnewid, sut i ni'n mynd o ble ydyn ni i ble ni eisiau bod. Mae yna lot fawr o waith yn hynny i gyd. At ei gilydd, mae dros 1,000 o systemau gwahanol yn cael ei defnyddio ar draws NHS Cymru am angen i ni fapio beth mae bob system yn gwneud a sut mae bob system yn cyfathrebu neu'n trafod a'n cysylltu gyda'r rhai eraill. Felly mae yna lot fawr o waith manwl yna. Mwyn delio gyda hynny, ni wedi comisiynu cefnogaeth allanol. Ni wedi mynd i'r farchnad, wedi bod yn cyfweld mynd trwy'r broses pwrcasu trwy mis Ebrill a mis Mai, a yn ystod yr wythnosau diwethaf wedi penodi cwmni o'r enw Channel 3 i gefnogi ni gyda'r gwaith. A mae'r gwaith hynny wedi cychwyn ddiwedd wythnos diwethaf, a mae Channel 3 wrthi ar hyn o bryd, wythnos yma ac wythnos nesaf, yn cael eu cyfarfodydd cyntaf nhw gyda y Bwrdd Iechyd, a wedyn byddwn ni'n rhoi'r y dulliau rheolaidd o gydweithio at ei gilydd. Un peth wi eisiau pwysleisio, wel dau beth, un yw maint y gwaith yma o ran pa mor fawr a faint o amser a faint o arian a buddsoddi bydd e'n gymryd i ni symud a gwblhau y broses o symud o'r bensaerniaeth sydd gyda ni i lle ni eisiau bod. Cwmpas y gwaith yw bob system digidol sy'n cael ei ddefnyddio a'r rhwydwaith, a'r offer, a'r laptops, a'r desktops, a phob peth. Felly, os ydych chi'n adio hwnna i gyd lan, mae'n swm sylweddol iawn. Ac yn ail yw faint o alw bydd ar adnoddau pensaernïol ar draws NHS Cymru dros y 6-9 mis nesaf yn arbennig. Ni yn DHCW ond hefyd yn y Bwrdd Iechyd. Y cwestiwn cyntaf fydd pwy sy'n deall y system, pwy sy'n gwybod sut mae popeth yn cysylltu gyda'i gilydd, pwy sy'n adnabod doniau bob system digidol sydd gyda chi, mae angen i ni ddeall hynny a wedyn mapio fe mewn i ADOC, a mae angen i ni hyfforddi bobl i weithio ar ADOC, a mi fydd hynna'n cymryd bobl i ffwrdd o'r gwaith maen nhw'n gwneud ar hyn o bryd. Felly mae'n mynd i fod yn bwysau ar bawb, a ni'n cadw golwg agos ar hynny ac yn gweithio'n agos iawn gyda'n partneriad. A ddau beth olaf sydd gyda ni o'n blaenau dros y misoedd nesaf. Un yw cyd-redeg y gwaith yma gyda'r gwaith mae Llywodraeth Cymru yn arwen ar EHR, felly Electronic Health Records. Mae'r Llywodraeth yn asesu opsiynau, mynd i gomisiynu rhywun i gefnogi'r gwaith hynny o'r opsiynau o ran beth yw natur a beth yw cwmpas y meddalwedd EHR. Yn amlwg mae hwnna'n elfen bwysig iawn o'r bensaerniaeth, felly mae'r ddoi pis yna o waith yn mynd ochr yn ochr a'i gilydd. Ac yn ail, pan i ni wedi cytuno ar llwybr y trawsnewid gyda'r Llywodraeth a gyda Bwrdd Iechyd, y rhai technegol, mi fyddwn ni wedyn yn cyfieithu hynny mewn i cynllun buddsoddi strategol. Bydd hynny yn dangos maint y gwaith, dwi'n meddwl, a hefyd beth i'w wneud gyntaf. A wedyn o hynny, bydd hwnna yn dangos i ni lle mae angen i ni ddatblygu achosion busnes a cynlluniau buddsoddi mwy manwl. Felly, mae'n mynd i fod yn brysur, mae hwn yn waith pwysig. Credu bod e'n gyfle arbennig i system fel Cymru i gynllunio y bensaerniaeth gyfan sydd gyda ni yn y ffordd i ni wedi cynllunio y bensaerniaeth ddata dros y 4-5 mlynedd ddiwethaf. A wrth bod ni'n mynd trwy'r gwaith, i ni'n gweithio gyda partneriaid ar draws y Deyrnas Unedig a rhai eraill er mwyn deall beth maen nhw hefyd yn gwneud. A ni systemau digidol nhw fel bod ni yn gallu cymharu a deall a sicrhau bod ni ar y trywydd cywir. Felly, fi'n credu bod yn waith cyffroes tu hwnt, a waith pwysig iawn, a fi'n credu bod mae tîm da gyda ni ar hwn, a mae yna frwdfrydedd ar draws y system i gyd yn cynnwys o'r Bwrdd Iechyd a'r Llywodraeth. Felly, fi'n edrych ymlaen at ddiweddaru ymhellach maes o law.
Thank you, Ivan. Any questions or comments from anyone? David.
Thanks, Simon. Thanks for that update, Ivan. So this is a great piece of work that will benefit not just our role in the system, but also the health boards as well. I just wanted to understand the scope leading up to that business case that you mentioned. So we're working on the 2B architecture, and we're going to map out with support from Channel 3, I think you said, the as-is architecture. There's a bit that follows on from that usually, which is the more difficult bit, which is trying to work out how we get from one to the other. And there's lots of trade-offs and there's lots of dependencies in that bit. Are we planning to do that work prior to that business case, or is the business case going to support that work post-approval?
Yep. Thanks, David. I'll take them one at a time because I think there's quite a lot to respond to that. Channel 3 is a technical partner, so the work that Channel 3 will be doing with us will be assessment of current state architecture, co-design of a target state architecture, and then, as you said, the transition roadmaps that get us from the current state to the target architecture. The key difference, I think, is that we are committed, and everybody's buying into all organizations using RDoC to do that, rather than everybody using their own different tools, and therefore it becomes quite difficult to map those things together. It's a really challenging and aggressive timetable to complete that. So I don't think it will be, sort of fully completed. In a sense, it will never be completed because the current state architecture keeps evolving. But again, that's the benefit of using an enterprise architecture tooling product like RDoC. When we've got enough maturity in that technical work, then we will move to a strategic investment plan. It's quite a high level umbrella type thing, talking, big numbers and years. And then out of that, we would expect to fall individual business case and individual sort of program development and program design opportunities. How far away they are will depend to some degree, I think, on conversations with government about the funding pipeline and the appetite from ministers and from officials to be able to invest in this. But I think the whole system buys into the need for a designed architecture rather than an evolutionary one, and the opportunity that we have in front of us. So we're trying to break it up into stages. I think there's a lot of ambition and challenge in this, but we have. I think that we've done a very professional job of the NDR data layer in the architecture, which is a bit more one-dimensional than the applications layer. I think and this is part of the update to the leadership board, the NDR is a 10-year program which has existed now for 6 years, a small diversion for the COVID pandemic, and has spent 30 million so far and is now getting fully into the operational space. So this is the sort of size and scale of what we're going to need to do in the applications layer in due course. So we're constantly reminding people of how big this is. A long journey and we're just getting started. But let's get a map in place first.
Thanks.
Okay, Rowan.
So I just wanted to, sort of reflect that this isn't a standing start activity. We've been thinking about many of the concepts that will be reflected in the architecture design. Ivan, can you just talk a little bit about some of the fundamental principles, open standards? You've talked about some of we've approved indeed purchasing of things like Microsoft, which are sort of sort of blocks that we know will be part of our future. Versus some of the more proprietary technologies that perhaps give us less optionality going forward, and just what the balance might be.
Well, I'll try and keep it brief because I could talk for hours about this. As you can tell, it's really exciting stuff, and it brings out the inner geek in me, I suppose. We're at the early stage, so we are talking about principles, and I think one of the first important ones is that we have made a commitment to wherever possible to adopt industry standard best practice, both in the way that we frame what architecture is, and that means a layered architecture with loose coupling or a complete lack of dependency between those layers, highly API defined, documented, using common standards. That means splitting it into a technology, data, and applications layer, using TOGAF, the Open Group Architecture Framework principles, using FHIR as a mandated standard mainly for messaging between layers, having a discipline about how applications speak to the data layer, and a whole bunch of things of that sort. And I think that's quite mature. I think people in the NDR community are fed up of me saying data is for life, applications are just for Christmas. But that is part of the mantra that we're trying to push into this area. There are lots of questions about technology, and sometimes it makes sense for us to use a technology partner. Our ambition, I think, is that the architecture is decoupled from technology choices. Now, there's a compromise at the edge of that. There's so much functionality that comes from the Microsoft Enterprise Stack, for example, that in some cases it makes a lot of sense to buy into a particular architecture that is a dependency on that. But in general, what we're trying to do is to build in to future-proof the architecture. It's a golden opportunity. You only get the opportunity to do these types of things when there's a real generational shift every 20 to 30 years. I have no idea what technology partners or products and solutions we'll be using in 2050, but we're trying to design an architecture that will be able to cope with that, where we will be able to substitute and bring others. We might well still be using Microsoft and InterSystems for LIMS and other major long-term strategic partners. The effort of moving from one technology product to another is gigantic at the moment, but a good architecture should make it a bit easier if the industry also moves towards that kind of interoperability, which the US administration, the European Union through the European Health Data Space is really trying to push the sector towards. But that's hard work, and that's going to take quite some time to roll out. So that there's a lot, and maybe we could catch up separately. We've done seminars for the NDR, and we've done seminars for wider stakeholders and various other things. Some of those I think are published as well as webinars.
Lovely, thank you, Ivan. No other hands, so I've been asked to note this report. I'm sure you're happy to do that. Thank you, Ivan. If we move on to the next section of the agenda, the governance, risk, performance and assurance, and the first item is an update on the work being done to address the escalation status. And as you heard earlier on, Chris has been given responsibility for leading on this. So I invite you, Chris, to introduce the item.
Simon, thank you. Yes, since the last board meeting, I think we have been moved into enhanced monitoring level 3 escalation about 10 days prior to. So I'm just going to run through some of the work that we've done since then. So we've worked closely with Welsh Government to confirm the arrangements for escalation and the plan to be monitored to inform our future escalation status. So I'm going to run through some of the work that we've done, the activity over the last few months, starting with DHCW's engagement on escalation, mainly with DHCW staff internally, also with the board and with Welsh Government. So on the 7th of May, we had a focus on escalation as part of our quarterly leadership day. So about 70 of DHCW staff come together in person. We had a focus on escalation, what it means for us, and also start to talk about the enhanced monitoring improvement plan and how we would track that through. It had some really good feedback, and it was a really interactive session, so that was really helpful. On the 13th of May, the Programmes Delivery Committee had a development session where we went through, again, the draft enhanced monitoring improvement plan and how escalation could be monitored going forward. And I'm going to come on to talk a bit more about that. And then, Simon, as you mentioned earlier in your report, on the 14th of May, we had an independently facilitated board development session to do some reflections relating to escalation. In terms of Welsh Government engagement, a meeting took place on the 14th of April. Myself, Claire and Helen were at that to discuss the initial proposed escalation framework that Welsh Government had developed. Since that meeting, the escalation framework has been iterated a couple of times, refined based on feedback, and that has now been agreed and confirmed by Welsh Government. So that's included within the pack. Just going to pull out a couple of things that the escalation framework says. One is that monitoring from a Welsh Government perspective will take place via the existing arrangements, so via the joint executive team meetings, which take place on a biannual basis, and monthly by the integrated quality performance and delivery meetings with Welsh Government. So they're already in the diary. So that is how escalation monitoring will take place with Welsh Government. Welsh Government also state in the escalation framework that they will introduce an updated governance system via the DDAD governance arrangements to support the delivery of national programmes. So we've spoken already through the board meeting about the status of the DDAD governance arrangements, but that is explicitly mentioned in the escalation framework. The escalation framework does require DHCW to develop an enhanced monitoring improvement plan. So again, that's included within the papers. It sets out DHCW's response to the areas of concern and the proposed milestones and actions that we plan to take mainly over the next 12 months to demonstrate the required improvement. It also sets out our planned actions around the areas for de-escalation, the de-escalation criteria. And I should say, I think Welsh Government have provided clear direction in terms of the areas they want us to focus on, and a clear scope in terms of the milestones should be relatively short term over the next 6 to 12 months to show the required improvement is being made against those areas that require improvement. So that improvement plan was approved formally at the Integrated Quality Performance and Delivery meeting with Welsh Government on the 14th of May. So we're now monitoring that plan on an ongoing basis. And in terms of the governance changes in response to escalation, I'm just going to run through these because they're on for approval, but I know board members will be aware through discussions. So we've had discussions at board and subcommittee level and agreed or proposed to ensure sufficient oversight and scrutiny that the Programmes Delivery Committee will have the subcommittee board oversight for the enhanced monitoring improvement plan, given major programmes falls within the remit of that committee. We have proposed that the frequency of meetings for that committee will increase throughout this calendar year, so 2025, so that in between each quarterly meeting, there will be a meeting to review progress against the improvement plan. So essentially meeting every 6 weeks as a committee for the calendar year, and additional time has been created to do that. An update will also routinely come to the board for escalation to monitor areas of concern over the course of DHCW being in escalation. And then internally, the management board will receive monthly updates. And as mentioned, we'll be reporting through to Welsh Government through the existing mechanisms. As that happens, I'll also be meeting with the head of performance escalation and intervention within Welsh Government regularly, just to touch base on areas of progress and any areas of concern. And then internally, the management board will receive monthly updates. And as that happens, I'll also be meeting with the head of performance escalation and intervention within Welsh Government regularly, just to touch base on areas of progress and any areas of concern. And then internally, the management board will receive monthly updates. And as that happens, I'll also be meeting with the head of performance escalation and intervention within Welsh Government regularly, just to touch base on areas of progress and any areas of concern. And then internally, the management board will receive monthly updates. And as that happens, I'll also be meeting with the head of performance escalation and intervention within Welsh Government regularly, just to touch base on areas of progress and any areas of concern. And then internally, the management board will receive monthly updates. And as that happens, I'll also be meeting with the head of performance escalation and intervention within Welsh Government regularly, just to touch base on areas of progress and any areas of conc Within the report, there's a section on additional escalation considerations, and it was just to note that since the board reflection session, which was held on the 14th of May, a number of areas I think came up from that session where I'm working with Simon, yourself and Helen just to develop a follow-on so we can get into the so what discussions and whether we can agree as a board areas that we want to see change, potentially broader than the scope of escalation, in order for DHCW to operate as effectively as possible and for this system to operate as effectively as possible. I think some of those areas came through the initial reflection session. And then finally, I'll just touch on a few risks or areas for escalation. So the first one is just to say, for major programs, the majority of major programs are delivered in partnership with other NHS bodies and partners. So within the improvement plan, you'll note that there's a dependencies column which sets out where and if actions required by other partners to achieve a milestone. This was something that I discussed with Welsh Government and it was agreed should be included so that we can, through this process, track where there are dependencies and how they are addressed or taken forward if progress isn't progressed. As a board, you'll be aware that major programs account for about 20% of DHCW's investment annually, therefore ensuring continued assurance over product and service delivery will be vital as we continue to have enhanced focus on major programs. And finally, board input and commitment during escalation. The time commitment, there is a time drain factor on board. So as you know, Simon, we've been discussing how we ensure that that doesn't get to a point where we're asking too much from board members from a commitment perspective. So those were just the areas to highlight in terms of risks and just looking for approval for the proposed governance changes to monitor escalation. Happy to take any questions.
Thank you, Chris. I've got a couple of questions already. Alistair and then Ruth.
Thanks, Simon. And yeah, absolutely. Thanks, Chris. I'm happy to support the paper. I just wanted to make the point that we initial disappointment and frustration at this escalation has developed into full engagement, and I absolutely support that. That is the approach that we're taking, and learning and development coming out of this initial example that Chris gave, the reflection session being one that could itself lead to one or two other areas of focus for consideration, as opposed to taking a different approach to this. I think it's absolutely the right one and commendable that we're doing that. It has therefore the real potential to be good for us in what we develop, good for our relationship with partners and stakeholders, including the Welsh Government, and that we're likely to be stronger as a result when we emerge from escalation. So I really just want to reflect that I think this is the right approach, and it's I think a good indicator of a mature approach as a board to something that started with, I'm sure, disappointment and frustration. Thanks.
Thank you, Alistair. And Ruth and Marion.
Diolch, Chris, for the update. It's really pleasing to see that progress is being made on the DDAC governance framework, and that the first meeting of that has been held. Welsh Government were also going to seek external assurance as part of this process, so I'd be keen to have an update on where we are with that, because obviously the organisation who comes in to do that will be a key working relationship with us as we build through this next phase. And it would seem that sooner rather than later, we would want to be having those conversations. And secondly, you note the board member time commitment. I mean, I think I would be significantly less worried about our time commitment than the time commitment that this is costing to the organisation. And I just want to recognise that. One of the things that I worry about is the alignment of all of our different objectives across the piece. And I know that Ivan and others, particularly within his team, have been doing a sterling job on making sure that everything across the IMTP, the remit letter, aligns with our actions in escalation. So I would say, on behalf of all my board members, that actually it's not our time you need to worry about, because we're prepared to commit the time to it. I think we just need to note that this is a significant time commitment for people across the organisation, and I really appreciate the time that's gone into that. So diolch yn fawr iawn to everybody there.
Before you come back on any of those points, Chris, and Helen might want to come on this, because I think it's really important the language on the external, because I hadn't heard the external thing in the context of assurance. I'd heard it in the context of support. Helen, what's your view on the exact? Because we've had it referred to by the Cabinet Secretary, we've had it referred to by the DG, and I'm still a little bit unclear on exactly what it is. And then you might like to fill it in on whether it's materialised.
Yeah, no, so I'm not aware of who has been commissioned to provide specialist digital data technology and advice into government in terms of the circumstance that they have at the moment. My understanding is that advice is into kind of senior leadership in Welsh Government, or the Minister and the Director General themselves, as they move forward strategically with the DDAT leadership governance arrangements, rather than specifically to deal with the escalation status of DHCW. But that's my understanding. I'm not sure if that will change as things materialise, but I understand that they're out to procurement for external advisory support at the moment.
Thanks, Helen. Chris, is there anything you wanted to come back on Ruth's points before I go over to Marion?
I'm happy to come back at the end, Simon.
Okay, Marion.
Well, my point builds quite nicely, actually, on the point, the original point that Ruth made, and it's about clarification in terms of the additional support that Welsh Government is giving us. And thank you, Chris, for a very clear and comprehensive update. I'm not entirely clear how that support from Welsh Government manifests itself to us in terms of the major programmes element.
Helen, do you want to come back on that?
Yeah, great. Thank you, Chris, and thank you, Marion. So as agreed now with the escalation or the de-escalation framework that we've had agreed through the performance and improvement colleagues in the NHS executive, we're in enhanced monitoring rather than intervention or special measures. So this is about ensuring that there are agreed milestones the government want to see progress on in terms of delivery against those major programmes, in order for them to be confident that we are making progress in those areas that they are concerned about. So the additional support is the agreement of the specific priority milestones that they want to see progress on in the next 6 months, and that we will use our monthly IQPD meetings and our biannual JET meetings with Judith and her team to oversee that progress is being made. If not, work through what it is that would be needed in terms of additional support. But that's the understanding of where we are at the moment. Chris, I'm not sure if you have any more information on that.
No, that's my understanding, Helen, as well. And I think it's into the digital policy team rather than the performance and intervention team. Obviously, they're slightly different parts of the health group. So I'll just comment on some of the comments that have come through. The additional opportunities comment from Alistair, I think it's a really good one for us in terms of where we are organisationally and the opportunity to look slightly beyond escalation at other opportunities and just consider how and whether we can as a board set some objectives. I mean, this is something we'll go through at board development in 6 months' time. What are some of the conditions that we would want to be in place across the system for us to be as effective as we can be as an organisation? So that's something for us to consider. In terms of the time commitment, I really appreciate Ruth's comments on that one. It's really valid because I've worked incredibly closely with Ivan and his team over the last month or so to make sure things have aligned, and they've been great in terms of giving all the time that's been needed to do that. But it is a time commitment, and I think it's worth acknowledging that the opportunity cost and the financial cost often when you bring additional resources in comes from somewhere, doesn't it? And it means something else either isn't being done or you have to prioritize it. So I think the impact of escalation from a cost perspective, we recognise. And I think finally, just on the support and input to the DDAC governance arrangements into Welsh Government as opposed to into DHCW, that is really important for us from a escalation perspective, because I think we would recognise that having that national governance in place, functioning as we would want it to function for the system, would be hugely beneficial for us to ensure we can deliver major programs, and the milestones relating to the major programs and the oversight through that infrastructure, I think will be helpful. So the speed at which that can be implemented, yeah, we'll be keeping a close eye on and working with government colleagues to do anything we can to make sure we support the arrangements.
Okay, thank you, Chris, for that. Now, there's a couple of things we've been asked to specifically approve the escalation governance structure and the changes to our governance to reflect the escalation monitoring arrangements. So, are people happy to do that? Thank you. And then, obviously, I'm sure people are happy to note the report, the framework and the enhanced monitoring improvement plan that Chris has introduced us to today. Okay, so on that note, we will take a break, and we're bang on 12:30. So if we could come back a couple of seconds before 1, and we'll start the second half of the meeting at 1 p.m. If I could remind people to turn off the cameras and my microphones. Thank you. Okay. Croeso nôl pawb. Welcome back. Just a couple of seconds. It might be Ridian camera isn't on. I don't know if he's. Okay. Well, I don't really might be struggling with his camera. Okay, everyone. So if we move on then to item 6.2, the finance report, and I'll invite Claire Osmondson-Little, the Executive Director of Finance, to introduce the report. Over to you, Claire.
Thank you, Chair. Okay, I've got my usual deck of slides. I will touch briefly on last year, as we are now full into year end and busy with year end audits. I will touch then on month one position for DHCW. So let's get on. So if you move on to the second slide. And again. Okay, so this really is our current subject to audit, which is currently underway, our position for last financial year against our statutory requirements. It's nice to see that they're all green, and the fact that our revenue outturned at 0.3 underspent, our capital was 0.45, our PSPP was at 97% against target of 95, and our cash balances, we got them down to 2.745 million. Our target was 2. So we were slightly above in terms of cash, and that really reflected a lot of activity in the last quarter in a couple of our major programs. So all being well, those will be signed off, and I'll touch on the timetable in subsequent slides. So let's let go of last year and touch into our 5th year performance. So if you kindly move on 2 slides. So we're now into 25-26, and it's good to start the year knowing your funded position. Actually, it's really helped, certainly from the team's perspective, in order to delegate the budgets and get on with the focus on delivery. So that's been really helpful, although there's a couple outstanding, and we'll come on to that. So we're forecasting currently that we are confident we will achieve our financial targets for this financial year. That's brave in month one, but we are confident of that position. Our outturn at the first month was a 72,000 underspend in terms of revenue. And that was despite the fact that we've had to cover a couple of costs in primary care related to WCCIS, and I'll touch on that a bit later. We've revised our savings slide to show you where we are in terms of our savings. We had a target of 3.4 million for this year. Obviously, we had recurrent savings that we put in the bag at the end of last year of 1.8 million, and we've got plans to achieve the others, and I'll show you that on a subsequent slide. National priorities, for those of you who are well versed around the table, that used to be DPIF. We're now calling it national priorities. We've got 20.1 million allocation for revenue and 9 million for capital. We've also got a contribution from other health boards and trusts related to some of those national programmes. And we do welcome that flexibility now about managing our portfolio around that, and you'll see that in subsequent slides. The capital plan, we have a discretionary allocation of 3.250 million. That's an uplift from last year of 9%, with an additional 281,000. But actually, our capital spend is obviously dominated by the national programmes, but again, we'll touch on that. Cash, you're going to start to see in the next quarter the cash balances increase as we get ready for that Microsoft payment due in July, and we're starting to see that filter through. We have a couple of risks around Connecting Care and the GP migration, and the funding of that, which we'll touch on. And inflation is still wriggling behind the scenes, and we had a few conversations on that in the procurement section. So our underlying, we're aiming to end the year with an underlying deficit of 0.4. I'd love it if we were able to get to a 0 position, but again, first month of the year, and unlike others, we'll work on that as the year progresses. So those are really the sort of high level financial summaries. But if you move on to the next page, I'll start to go through some of those details in month one. Okay, so 72 underspend, and you'll see in a subsequent slide why that is. The capital, we had a spend of 354 million. Again, we're reasonably confident around the spend process behind that. Our spend, paying our suppliers promptly, we're at 98%. In fact, we're one of the leaders in NHS Wales in that context. And then our cash balances, as I alluded to before, we're starting to see those increase. Are currently up from 2.7 to 4.3. And again, as the months progress, that'll go into double figures in order to facilitate the Microsoft payment. So if we move on to the next slide, then this really highlights why we were 72 under. So we're starting to see that the ones in red are really as planned. So our primary care mental health during the month, we are awaiting, we have submitted our connecting care business case, and within that case there is an allocation for the continuity of WCCIS as part of that. Again, that case hasn't been approved by the DIP process yet, but we're anticipating that, and therefore we've run at risk and absorbed that cost pressure within our results for month one. I think, in all honesty, we're going to see that approval slip. So in which case we've anticipated a Q1 pressure in that directorate as a result of that. And as you can see, we can quite comfortably absorb that, because certainly within the other directorates, we're seeing slippage in vacancies again, which is enabling us to offset that cost pressure, notably in operations. So operations have done quite a bit of work changing their operating model, and we've also had an increase in our core. Consequently, they've got slight underspend. They are looking to do a number of non-pay work packages, and there is a lag in that, so that will equal itself as we go along the quarter. So again, a good start to the year. There's some key variations in that good start to the year, but actually it's helped us in some ways absorb some of the WCCIS pressures that we were expecting. Okay, if you move on to the next slide, this really just looks at our run rate for the forthcoming year. This is month one, so we're seeing a start position of just shy of 6 million a month for pay and 8 million for non-pay. And again, variations in the months really reflect the non-pay pressures and movements for programs, but also notably for the vaccine activity that we've got planned later in the year. But that really gives you a flavour of what we should expect in terms of spend. And then I moved on to the next slide, which is really about our savings plan. This is a new version. We are looking to update our financial deck. Mark and the team are looking at that once year end is over, to sort of bring it in line with the finance delivery units presentations that are done at chief exec level. We're pinching some of their ideas. Anyway, this is showing our savings plan. So at the start of the year, we had a requirement to close the gap between our cost pressures and our funding of around about 5 million. But actually 1.5 of those, as a result of savings that we put into plan last year, and the full effect of those this year will also offset that by 1.5 million. So our target savings plans for this year is 3.4 million. We have recurrent savings already identified within that of 1.8 million. So actually that leaves us a balance of 1.6 million, which we have allocated, notably operations actually, across the directorates. Subsequently, since this slide has been done, although this shows 1.8 million amber, we're looking to close more than half of that within the first quarter. As a consequence of the move from the data center and the operational opportunity that's created in terms of savings. So that's where we are as of month one, which is a good position to be in, but we have still got some work to do around the directorates to mop up the balance required in order to balance our books this year. So I'll move on to the next one slide, which is really covering the detailed of our National Priorities Fund for this financial year. So that breaks down that 21.5 million, which includes both Health Board and Welsh Government funding. Obviously, there's not much to talk about in the first month, except for to highlight we have been given some more funding. So it's now been agreed that Welsh Government will allocate to us the NDR funding that's going to be dispersed to other health boards and trusts. So they've already given that, and also we had additional, as doing the additional work for the NHS app, we've also had an additional 1.5 million. So I think it just shows that we are trying to work as a portfolio and alongside work closely with Welsh Government to really get that that balance right for the forthcoming year. Then if you move on to the next one, which is about our capital plan. Again, the top half is really our own discretionary plan of that 3.2 million that I alluded to. Most of that is going to be allocated to the ICT team, where they're looking at investments around security, but also operationally. And then there's also an allocation for the facilities and estates to really address some of the issues and some of the opportunities we have in that space. The 9 million that I talked about from the national priorities is really dominated by the RISP and LIMS programs, but there's also notably the cloud transition allocation, which is obviously a DHCW predominantly funded initiative, which is great, which is good stuff. And then if we move on to the next one then, so as a month one, what are our risks and opportunities? We still, although we started the year with a full tank of petrol, there were a couple of programs where we still didn't have clarity on funding, and that still remains the way. So we've got Connecting Care and that business case awaiting decision point, but we've also got the impact of accelerating the GP rollout and the migration plan. So those two are still areas that we're working closely with Welsh Government to understand what our allocation will be. We've also restarted the work around critical care with workshops planned, but again, as a result of that, it's unclear if there are going to be additional cost pressures, but we've included that. And the old nugget really is that digital inflation. As we alluded to before, we are seeing changes in the market, but also general inflation in the area increasing. So we are working alongside directors of digital to have a common narrative around what that impact is. And Mark and the team are working alongside them to come up with a number and some analysis that looks at it nationally, not just as a DHCW perspective. But all's not lost. We do have some opportunities, that flexibility in our portfolio. We see that as an opportunity, and we're working, like I said, with Welsh Government. We are looking at our longer term efficiencies as part of building our future. And obviously we've built in some of those short term ones into the month. And my favourite one, the Microsoft VAT recovery. Obviously in July, we will be looking to release 3.9 million back into the system as a result of our position around the VAT recovery. We're still working on releasing the others, but that needs a bit more work in terms of where we are with HMRC. So those are our current risks and opportunities. And then finally, on the next slide, I just wanted to mention, obviously, we're into year end and the annual accounts. My team are working exceptionally hard this year in that space with Welsh Audit Office. In terms of timeline then, obviously the 26th of June is when we will take those finalised, hopefully approved, and accounts to the Audit and Assurance Committee for SHA approval. And then we're planning obviously to submit those to Welsh Government on the 13th of June. And I think that is the last slide. So that's really just a review of where we are as in terms of the latest position at year end, and obviously the current position after the first month of the year. And I welcome the board to note the position, and I'm happy to answer any questions.
Claire, just before the couple of questions, on the dates on the penultimate slide,
Yeah.
the audit committee and the board are on the same day?
We usually meet before the
So,
SHA.
right, okay. Yeah, okay. I'm just thinking about the timings of the, so is that just a single item audit committee meeting then? Yeah, okay.
Yeah, and we've also taken the audit committee through the draft accounts on May the 2nd, so they're well cited on the current accounts and all those tables. You love those every year, all the tables. And also we've highlighted areas, you know, that will be a focus for the audit. So I would hope that there wouldn't be any surprises. It's a matter of course.
Okay, Alistair and then David.
Thank you, Chair. And Claire, just to first of all support the paper in front of us, but also to say really extremely well done concluding the year in the way that it has been concluded. And really that extends to all the colleagues on this call and beyond, because it's the focus of everybody across the organisation to manage the costs and expenditure efficiently that we're always looking at these meetings, and it's really impressive. So I just wanted to say from my part, thank you to everyone on this call and beyond for their part in doing that, and Claire for your making sure that they do with that large whip that you've got in your office. Just a couple of questions, if I may, Claire. You know, the Connecting Care and GP migration being currently core-funded by education. It may be too early to do so, and it may be Sam Hall would respond to this. In terms of any prospective timing around Connecting Care and GP migration, in terms of when that might be, those might be business cases that are accepted. And just, if I may, while I'm just putting in question that, you know, if risk assessment to a certain extent is like weather forecasting, I get that, you know, trying to see what's lies ahead next month is pretty challenging. But and on a global macro scale, we might not want to get lost in speculation. However, the pharmaceutical industry looks like it's now in the crosshairs of macroeconomics. And you'll find many economists in the UK are saying that is likely to result in increased cost of pharmaceuticals to the NHS. In which case, I just wonder if there's anything we should begin to put onto the kind of dark clouds that might be looming ahead in risk assessment of any impact on the cost of managing the NHS that might squeeze other parts, non-clinical parts that might be seen of the NHS, which might involve ourselves. So it's just really those few. Thank you.
Okay, so shall I answer that one, Simon, and then come back? So there's a couple of things in that. The timeline for Connecting Care, if only I had a glass ball, but I know that we are meeting with Welsh Government. We've got meetings aside in Q1 and Q2, and they have indicated that in the event that they need longer to make a decision around Connecting Care, they would look at WCCIS separately, and it's for us to then pull that together. So, so in terms of the risk for us in this financial year around that, that there is an acknowledgement of the importance of the Connected Care case, and there's also a willingness to refer to that. And we were going to meet on that matter before the end of Q1 to finalise our Q2 position in and around that. In terms of the GP migration, Sam and I are working hard with our teams in understanding what our options are there, so that we can present to Welsh Government a costed set of options around the rate at which they may wish to proceed with that particular programme. In terms of getting an answer on that one, I think we're talking about a number of weeks, and we don't have a firm date, but Sam and I are working on that collectively in terms of getting that one bottomed out in terms of a requirement. And then the black clouds. So it goes back to my comment about inflation. I think if you look at DHCW and risk exposure, where inflation hits, other than payroll, which is paid for directly by Welsh Government, and there's obviously going to be some interesting challenges there. In terms of the non-pay, most of our contracts are multi-year, so we have some visibility of what's ahead of us. In the short term, there are a number of big contracts. In fact, our biggest contract, which has been a focus of the board today, isn't it, The Microsoft contract, which will come into effect next year, this time next year, I'm not sure what that outcome will look like, but it potentially could be a material number. And what we are trying to do through the excellent work that Evan is leading in the architecture is really look at how we reduce our exposure through the number of licenses that we have and some of the software that we use to simplify it. That won't be in the short term, but it might be that we could look at some of that in terms of the way that we tackle it. And obviously from an efficiency perspective, the work that the commercial teams are doing to look at what are the DHCW opportunities and risks, and what does that look like nationally, and how do we work together in the system to mitigate those is also an area to look at. But I think there is a lot of uncertainty in the market. There's a lot of general underlying inflation, and obviously we're exposed to whatever. Certainly in some of the areas, if you look at things like Microsoft, which are predominantly dollar related, there are also complexities in an international context. But I think locally we have got a grip on what levers we can pull, and I think increasingly through the Directors of Digital, we're trying to work as a system so we get a coherent narrative, so that we can inform Welsh Government of what this means for the digital community in Wales. So that's where we are on that one.
Thank you, Claire. David.
Thanks, Simon. Thanks, Claire. Can I echo Alistair's compliments in closing out last financial year in great shape? So thanks, Claire, for your leadership, and thanks goes to the team as well. If I've understood you correctly, I think congratulations are in order for the Microsoft VAT recovery position, which you've pursued over at least 18 months to my knowledge, if not longer. So yeah, we are actually getting some money out of that. Again, well done on that front. And then I have two questions. So similar to Alistair's point, we've got some uncertainty over the funding for Welsh Intensive Care Information System at the moment, which is ongoing, I know. I just wondered if you or anybody else on the call had a view on how long before we know what that is and whether we've got a position to close that one out. That's question one. And then question two was at the Programme Delivery Committee, we received an alert around Digital Maternity Cymru being paused, but I noticed on one of your charts you've actually spent some money this financial year. So question is, has it been paused after we spent some money on it, or is it no longer paused and we're actually back doing something on it? I'm not too sure which of those scenarios it is at play.
Okay, so I'll bring in Evan on that maternity now, if you like. I mean, there is some spend on it, 32,000, I think, year to date. But even in terms of the status of the programme, maybe you want to comment on that one.
Yep, certainly. So, David, what we've agreed is we're going to close the programme. We're going to close the national programme in an orderly, managed way, which will lead to a closure report in the way that things usually do. We have a team that are on that programme, and we also have a chair appointed on that programme. So there are some costs that are still being incurred. At the same time, we start up a project which is focused specifically on data record standards for maternity, and these will run alongside each other. So we're roughly aiming for September, the end of Q2 at the latest, to have closed the programme. And the project board actually is meeting for the first time this afternoon. So and we're going to try and get through that timetable as quickly as we can. And then separately to us, the health boards, the 5 of them that are yet to implement a maternity system, they are coming together in their own programmatic, I guess I'll call it, right? Programmatic governance with a technical and a clinical design authority in order to manage and coordinate the implementations that they are doing. So there's still some run on, but there's no change in the decision to close down the programme, which has been agreed with Welsh Government.
Thanks for the clarification.
On WICIS, I don't know, Helen, your hand went up at that point. Did you want to comment on WICIS?
Yeah, no problem. So we're now moving forward with the revised governance arrangements post the independent review that was commissioned by Welsh Government. So that is happening tomorrow, I think, actually, the new programme board with the new chair in place. And also the workshops to bottom out the redesign work that is going to be needed in order to get to an implementable state with the software. Those workshops are commencing, I think, this week, actually. I think one of them is this week, but they're commencing now through over the next few weeks, with a view that over the summer, there will be a workup with ourselves and the representatives from the health boards involved, so that ASCOM can work through what that looks like in terms of resource requirement, in terms of timeline, in terms of feasibility, with the expectation that by September or in September, we will have a plan from them that we can then share with government in terms of making a decision on a way forward.
Okay, great. Thanks, Helen.
Okay, Rowan.
Just one small point, really building on Alistair's point on sort of the geopolitical context. Not so much about the pharmaceutical industry, but I understand from London Stock Exchange and others, their biggest concern is really around the risk that if the US government realizes that much of the cloud is located in the US, that there would be additional controls over cloud capability sort of spun up very quickly. And that coupled to massive investment from the Middle East in data centers, in large part to analyze electronic healthcare records with some of the deep, I think it's called Deep Space, the initiative between Cerner and OpenAI and SoftBank, etc. I think we have to expect that there's going to be a really strong upward pressure potentially on a lot of those capabilities, which truly impact our day-to-day running. So I think that's just something to think about in terms of the corporate risk register.
Okay. Helen, come.
Just a minor point there, just to kind of clarify that the cloud contracts that we have and the data centers are all kind of situated in the UK from our perspective in terms of our use. Just to clarify that point.
Yeah, I think I was going to make that point, but I think the point Rowan's making is that there would generally be an upward pressure on cloud prices across the world as a result of what's going on in. I think that was your. Oh, where's Rowan gone? Oh, she's gone. Oh, there you go. Oh, there she is back again. That was your point.
I'm there, and absolutely, that was exactly the point I was making. Thanks, Simon. And Helen, from a data sovereignty point, absolutely, our health data doesn't leave Wales.
Well, I think
well, at least without permissions.
In America, the law is that the security services can access data, so no one actually puts data in their cloud. Anyway, one thing, observation I had, Claire, and I'm trying to think of the word. From your presentation, you gave the clear impression that the allocation of money from Welsh Government this year had been significant, better. Let's just use that word that it had been previously, and that's had a beneficial impact.
Yeah, I think we've never started the year with all the SLA letters signed. So we've got that certainty, and also having a really clear steer on our position and the way that we've allocated in our National Priorities Fund. And that has enabled it has enabled the programmes actually. And I know there are a couple of programmes that are having, they've got budget challenges, but it's enabled them to actually really focus on the delivery rather than chasing the funding clarification. So that's really helpful from my team. And yeah, so that's been a real winner.
Excellent. And we've been asked to receive this, and I think it was Alistair's point, the appreciation for all the work that you and your team have put in to get us to where we are on last year's financial position.
Yeah, and I should note, Chair, that I've got a very good finance team, and they're really supportive. They've worked tremendously, and they are under a lot of pressure at the moment. But in terms of our context and against the national context, obviously we've started the year with an underspend. I think we're probably in a minority in that space. It is very challenging within the broader financial context. And I've just had our response from the month one monitoring return and commentary, and it's really saying organisations have been asked to take prompt action to ensure they de-risk delivery plans. And that for me is the savings part that you saw and the pie chart. I think we're really in a favourable position with that now, and our focus will be on the delivery of those those plans, which is really much incorporated within the BOF. But from a DHCW perspective, to be in this position, we're probably in the minority in NHS Wales, starting the first month of the year in a positive and strong position. So we've just got to keep it there and keep moving forward.
Yep. I think probably is the understatement of the meeting. We're definitely in the minority. Okay, thank you, Claire, for that. If we move on then, and don't go away because you're presenting the next item, the performance report 6.3. So over to you again, Claire.
Yeah, and I'm really excited about this one. So as you know, the performance team have been updating the performance management framework over the last year, actually, collaborating with yourselves as the board through the board development sessions, but also with the DHCW senior teams and their SLTs. And they've looked outside, they've looked at what other health boards are doing, and also benchmarked with NHS England. And they've worked with Gartner to really go to the roots of what a good and effective and relevant performance framework really looks like. So, and I think it's been a challenge, actually, because it's not an easy one to shape. And also given a backdrop that at the same time we went into enhanced monitoring, so the team have had to up their game in terms of our monthly IQPD. So I would like to take this opportunity to thank the performance team, and in particular Angela Haggart and Chris Morton, who have led the exercise and have really underpinned delivering the first version of our revised performance template, and for the performance team behind the scenes who have really worked hard to automate much of the data collection and to slimline a lot of the reporting. So even we'll be delighted it's really adopting some of the principles, strategic principles, simplify, efficiency, etc. So we've adopted a really balanced scorecard approach, which is really linked to our principles and strategies. And we've tried to identify the right measures and set the right targets and adopt industry standards and take learnings from other parts of the NHS in the UK. So we've really tried to adopt statistical process controls, SPCs, Helen particularly likes those, to drive the performance improvement. We've identified areas, really sort of focused on areas of variation to look at trends over time, which in the report circles. We've also looked at assurance, which is looking at our performance against targets, which are squares. And we've really tried to incorporate, which has been really challenging, the 12 domains of quality, but we've done it, but it does bring some colour to the report, as you've probably seen. So we've split our scorecard into a number of key areas. We've looked at organisational capacity, which really builds on the stakeholders. So Marion quite rightly asked us, how do we measure that? So we're building our stakeholder dashboard. We're also looking at workforce, and not only just looking at workforce in terms of headcount, but also in terms of equality, inclusion, and we've also incorporated risks. And then we've looked at and we've renamed process and finance stewardship, which really homes in on our milestone delivery, which obviously in month one isn't much to read, but bear with us, it will grow. Operational performance, which really tries to home in on what that is in terms of availability, incidents, migrations, desktop support, and it also includes primary care. We looked at security, quality, audit, and commercial. So this is our first report in that new format. There are still a few changes, as you can imagine, we'd like to make, and it will develop. But I'm delighted at the start of a new financial year, we have a refreshed performance report to support our delivery in the year ahead in a balanced and reported way, I hope. So I'll move us on then and talk about some of our current priorities in the report. So a lot of this we've covered during the board today, but obviously over the last month, time and activities to align our remit letter with our IMTP have taken place. And we've also presented as part of the remit, the Building Our Future initiatives to Welsh Government. Within our major programmes, as Ivan has alluded to, the National Target Architecture project is progressing well. And now and work is on board with health boards and also with our new commercial arrangements to underpin it. We have submitted our Connecting Care business case to Welsh Government, and we continue to work through the implications in result of relating to IMPS position, which we discussed on in the finance report. So if you look at our stakeholder performance, our NHS app logins continue to increase. We now have more than 465,000 logins. The actions on our stakeholder plan are progressing very well, and all our SLA letters are signed, sealed and delivered, which is good because we can now focus on driving the value. Our organisational capacity, actually, as noted by some of the IMs earlier, the head count, and there have been minor movements in turnover in the month, but again, we're focusing on that as we discussed earlier. Our internal process performance is good, with milestone performance really dominating the carryover from last year, as this is the first month of our plan. And our security compliance is broadly in line with plan. Our service availability was below plan in the month, and that related to one incident which was rapidly resolved, albeit it did cut over the time restraint in our SLA. And focus going forward will be on the service desk. So that is an area that we are looking at in terms of performance. Then in terms of finance, as I just discussed, it's mostly on plan. And in terms of the missions, I won't go through each of them, but just a couple of note. In terms of mission 1, which is providing a platform for enabling digital transformation, the cloud transition and the API onboarding process are progressing well, and we saw some activities delivered in the month. Mission 2, in terms of delivering good quality digital products and service, we've made good progress with the GP system migrations and the refresh. And then in terms of risk, we have been doing quite a number of testing, and the focus in the programme is really addressing the necessary changes as a result of the testing. And then in mission 5, as alluded to in the Building Our Future, we've been training on the 5-minute improvement as part of the continuous improvement actions. And the only thing to note is really relates to the LIM system, which again, we've been testing during the month, and we now have a revised deployment plan split into 2 tranches, and obviously subject to operational licensing arrangements. So that's really the key summaries of the month. I think I'll open it up to questions now, Simon.
Yes, it's getting your head around all the different colours and the squares and the dots and the... Okay, Marion, and then David.
Diolch Cadeirydd, a diolch yn fawr Claire i ti am y cyflwyniad yna, a hefyd yn benodol ar yr diwyg newydd o ran yr adroddiad perfformio, sydd yn rhywbeth dwi'n meddwl bod ni gyd yn ei groesawu. Mae nghwestiwn i'n ymwneud yn benodol â chenhadaeth 5, cywireinrwydd sydd gen i ddeall mwy am y cynllun hyfforddi 5 munud. Beth yn union mae hwn yn ei olygu, y cynllun gwella hyfforddiant 5 munud, ac oes na gyfle fan hyn i ni rannu yr hyfforddiant blaengar yma gyda'r byrdde iechyd ar draws Cymru.
Thank you, Marion. And yes, so the 5-minute improvement is something that we actually took from the blood transfusion service. So it's an initiative that they use quite regularly over there. And we're hoping to adopt this across Wales. We have a dashboard that underpins it, and basically it's saying, take 5 minutes of your time, have a look at and consider what are the things that you would like to change or enable to change in order to do that. So some of the changes that we've seen today have been, for example, about the time frames around meetings. So finishing the meeting 5 minutes early to enable you to have a break before the next one. It's really about looking at practical improvements that we can just do, but like any change is really enabling the time to do it. So actually that's really probably a little challenge for the IMs as to whether they would like to undertake the training and join the team in terms of building a 5-minute improvement. So maybe I'll take that offline, Marion. But yes, so it's really about trying to engage the broader DHCW team to consider what are the areas, taking time out and seeing what can we improve, and building on that obviously is the next frame, is what matters to you, where we can take the bigger changes into a forum to drive them forward. So once it gets established, I think we'll share, but we actually pinched it from the blood transfusion service, so that was quite helpful.
Thank you, Claire, and I'll happily rise to the challenge, and I'm sure very happy to do so. Diolch yn fawr.
Thank you, David, and then Sam Lloyd.
Thanks, Simon. Thanks, Claire, for the update. I just wanted to say well done on the new template. I really like it. It sort of jumps off the page, some of them. I particularly like the adoption slide and the upward trends on the graphs of users, which is really helpful. The thing I wanted to pull out was on the NHS Wales app, we had over 2,000 cancelled appointments, which I think represents the better side of the app usage, which is people can cancel that online. And I think that would encourage GP practices maybe to make more appointments available online if they know that actually they're going to save time when people are able to cancel them through the app. So I'm hoping I'm reading some positive intent in those figures. But thanks for the format.
Yeah, that's great. And I will feed that back to Angela because she's worked extremely hard to get that right. And it is a difficult and complex beast to get that scorecard right. And in terms of the app, I think it goes back to a point I think Sam Hall raised earlier about being open and transparent and showing the information that we feel is relevant in terms of our delivery. Yeah.
Okay, so I was just looking at the app login trend. Sam Lloyd.
Thanks, Chair. I just wanted to comment on the service desk performance point that Claire raised. So we've, I think it's particularly looking at the first line fix rate, which is, percentage of calls which are fixed at first contact with the service desk, which is consistently below the target that we've set. We have set a 40% target there, which is quite ambitious. I think that's quite a stretch target, and the level that we consistently above is about 25%. So actually 1 in 4 calls we're closing at first contact, which is not too bad a position to be in. But I think we're limited at the moment by the technology. So the service point tool that we're using is not really supporting self-service, which is really the long-term solution to this problem, I think. So as we move towards a new service desk tool, I think we would expect to see that number improve significantly. We would also expect to see the overall volume of calls decrease because people will be able to resolve calls themselves through self-service, which would be quite a key feature of the new product. So strategically, I think we have a resolution that we're working towards in that regard. Thank you.
Thanks, Sam. Sorry, I do need to ask this question. So we're on the NHS Wales app distinct logins. Is that counting the number of times you log in, or is that counting the number of people who have downloaded the app?
I'd have to check. I think.
Yeah, I believe it's the number of distinct users that have logged in to the app or to the website.
So it's not. So
if I log in 5 times,
490,000 there and thereabouts people who've downloaded the app and logged in on for us. Yeah.
I believe if I log in 5 times, that counts as 1, not as 5.
Yeah. Well, otherwise it would be a huge figure, wouldn't it?
Yeah.
Okay. Thank you. Any other questions, comments? No. Thank you very much, Claire. And we move on then to the item 6.4, the Corporate Risk Register and Board Assurance Framework Report. And I'm going to ask Chris Darling to take us through this item. Chris.
Chair. Yeah, I'm just going to work through the report, which covers the current corporate risk position from a corporate risk register perspective. It has the Board Assurance Framework dashboard for 2025-26 included, and there's also our risk appetite position that we've discussed as a board over the last 2 months. So just starting with the report, we start with opportunities. There are a number listed. I just want to draw attention because we have added to the list. The NHS Wales digital blueprint work, we've added that as an opportunity. I know there was an update paragraph in Helen's chief exec report, but I think that is an opportunity worth noting. for Digital Health and Care Wales. The increase in prominence around the information governance policy position over the last few months, we've added that as an opportunity, and also our escalation status, as discussed earlier, as a potential opportunity for DHCW. In terms of just continue with some context, the World Economic Forum Global Risks Landscape 2025 was documented a few months ago, and the focus on cyber insecurity, and as Rowan mentioned earlier, the geopolitical threat landscape changing significantly, particularly over the last few years in this area. And we've had extensive discussions at the Digital Governance and Safety Committee around this, but I just wanted to flag that because it's clearly not unique to us, but it is a massive global threat, both to us in terms of our sector and other sectors, as has been seen over the last few months. In terms of the corporate risk register and our position, there's 18 risks on the risk register, 15 are documented as public risks. There are 3 that are considered in private session, all at the moment via the Digital Governance and Safety Committee. I'm just going to work through the changes in the risk register since the last board meeting. So there's been 4 new risks that have been added. The first one's the DDAC governance review implementation. I think we've probably covered this in terms of the discussions today, but this just, I think, recognizes that without the implementation of the DDAC governance review recommendations that were published in December and getting that national governance structure in place, there is a risk around ambiguity and lack of clarity in terms of roles, responsibilities, as well as uncertainty around where collective collaborative decisions get made. So that's gone in as a new risk on the risk register. There's 2 additional risks, 0347 National Target Architecture Transition Roadmap and 0348 Data System Transitions. I'll just ask Ivan if he's okay to update on these. They've come in approved by Ivan.
Thanks, Chris. Diolch yn fawr. So yeah, there are 2 new risks trying to highlight things that are of system importance with a degree of uncertainty around them. We've been commissioned by the Welsh Government to develop a new national target architecture, and I gave an update previously on that, which I hope the board was able to take a good assurance from. But it's not entirely within our control because it needs to be a collective agreement involving us and all of the local delivery organisations and the Welsh Government, in fact. And so we're recognising that risk. If we can't reach a whole system agreement, then that is going to delay progress, and it will make it less clear the investments that we need to make and the pace at which we can go. And then the second bit is about the data system transition. There's still some uncertainty around that, which is out of our control. There are things that we can focus very much on, which is the transition from the existing national data stores that we hold on premises, to be clear, the existing data infrastructure that we hold on premise, things like Welsh Care Record Service and the Welsh Results Reporting Service. But we can't unilaterally pull things in from local data stores into the national data resource. So again, the pace at which that goes and the progress that we make is out of our control. It depends on a combination of influence and engagement with stakeholders from us and direction from Welsh Government. And so there's a degree of uncertainty around it, which is what we're trying to identify here in the risk register, things that we can't accurately predict, and therefore there's a sort of there's a span of what might or might not happen, which we need to mitigate the best that we can. So I think they're well framed and they're important at the system level, and therefore should be on our corporate risk register.
Thank you, Ivan. The 4th new risk is 0207 Document Management Strategy, and this one has come on approved by Claire, just recognising that the adoption and rollout of Microsoft 365 has meant the strategy needs to be updated to ensure we maintain our accreditation, ISO accreditation. So hopefully, I think, Claire, the intention, that's quite a quick on and then off. We just make sure we've got that oversight so we do what we need to do in terms of mitigation. The risk that's been removed since the last meeting, board members will be aware we added the remit letter uncertainty just probably about 3 months ago, as we didn't have it at the time to reconcile back to the IMTP. That work, as we heard earlier, has been done and is being done, so that risk has been removed. There is one private risk that, again, Digital Governance and Safety Committee members will be well cited on in terms of that coming off and the rationale for that. So I'm just going to move on to the board assurance framework dashboard and the risk appetite position. So section 4.5 of the report links to the board assurance framework dashboard for 2025-26. The dashboard has been updated based on feedback predominantly from Audit Wales following structured assessment last year. You'll note it's the same overall, but there's a slightly different look and feel to the dashboard. We have, over the course of the last 12 months, used the board assurance framework report and the areas within to inform agenda planning meetings with committee members. I think have successfully deep dived in a number of committees on areas relating to the board assurance framework. So an example being the sustainable funding model has been taken to the Audit and Assurance Committee a few times in relation to Strategic Mission 5, and likewise our information governance policy and our research and innovation approach for missions 1 and 4 have gone to the Digital Governance and Safety Committee a few times. Over the last month or so, exec leads assigned to each of our strategic missions have updated the board assurance framework dashboard. They've reviewed the principal risk articulation, the risk score and the target risk score. And board members will be aware on the 10th of April, we reviewed the risk appetite position and statement, which is the second slide in the board assurance framework dashboard. And that's on within the papers today for approval. So just to pick out a few points from that, the statement, the risk appetite statement does say that we as an organisation must take risks to achieve our strategic aims and deliver beneficial outcomes to stakeholders. So I think we're acknowledging we have to take risks over the next 12 months in order to achieve our objectives. We've also added to the risk appetite statement that we recognise that because we work in collaboration and partnership in delivering a number of our objectives, the impact of our partners' risk appetite will impact us, and therefore we will work with partners to understand this. That's been added to the risk appetite statement. So I just wanted to draw that out in terms of changes. And then finally on the risk appetite, just to summarise for each of the strategic missions, our current risk appetite position for mission 1, providing a platform for enabling digital transformation, we've assigned that as cautious. For mission 2, we've assigned for delivering high quality digital products and services, moderate. For mission 3, moderate. Mission 4, driving better value and outcomes through innovation, as open, and mission 5 being the trusted strategic partner, moderate. And we did move from cautious to moderate for mission 2, and we've put in a couple of examples in the paper of where we've brought that to life and some of the approaches we've changed as a result. So I was just going to ask Sam Lloyd, as the mission lead, the exec lead for that, if he wanted to just expand.
Yeah, thank you, Chris. I think the change from cautious to moderate really does represent a conscious move to a different delivery approach in mission 2. So, some of the initiatives that are now underway in that space, which are really around modernising core components of our underpinning architecture, so integration hub, e-referrals engine, for example, we're really consciously not taking a formal waterfall approach where we spend months or years writing a business case, seeking funding for the entire initiative, and then proceeding through a traditional kind of delivery pipeline. It's interesting to contrast because the cloud business case, which sits in mission 1 with a cautious appetite, we have taken that approach. It's absolutely appropriate. But for this new kind of modern software delivery approach that we're adopting, we're moving to an agile methodology, which is much more about learning by doing a discovery, then an alpha phase, then a beta phase. And by taking that approach, particularly with the integration hub, we're at a point where we're actually going to have a live service within a few months, whereas that may have taken years before. It's aligned with a new operating model. It's aligned with us intending to increase our pace of delivery. So I think it's absolutely the right approach for us to be taking in this space.
Thank you, Sam. Yeah, I think it's really important just to try and bring to life where we have tried to change our risk posture. And I think, thanks, Sam, you've really highlighted that. So just conclude this section, Chair, by asking if any of the exec leads for the strategic missions want to add anything in terms of progress and any areas in their action plans to address the principal risks relating to their strategic missions. No.
No takers. Okay.
So just asking, Chair, for the risk appetite statement to be approved and then noting the position from a corporate risk perspective.
Okay, people happy to approve it. We've obviously had opportunities to discuss this in the recent months. Yeah, looks like it. Thank you, Chris. Okay, so I can move on now, can't I? That's, yeah. So moving on to took me by surprise there, Chris. We normally take longer to go through that item. 6.5, Programme Delivery Committee highlight report, and I'll invite David as committee chair to present anything he wishes to highlight from the report. David, over to you.
Thanks. Excuse me. Thanks, Simon. 3 things I wanted to pull out. So first point was we still have 4 programmes which are not progressing according to plan. All of which are outside our direct control in terms of the issues. We've touched on a couple of them. Digital Maternity Cymru is paused, and we had a little bit of a discussion when I asked a question of Claire on funding around or spend around that. The National Digital Eye Care Programme, the national programme has been closed, and Cardiff and Vale will run forward with that. Welsh Intensive Care Information Systems, Helen gave us an update on that. It's basically on hold until we've understood what scope is needed to get that back on track in terms of a deployable solution. And then the funding arrangement around Welsh Community Care Information System and Connecting Care, we've also touched on that. As a committee, we spent quite a bit of time looking at the escalation and the framework that Chris has put in place for de-escalation. All of the major programmes that are covered by the escalations are within the scope of the committee, so we felt we needed to spend quite a bit of quality time on that. I think by the end of that, we were assured that we had a robust framework in place for de-escalation. And as a committee, we agreed to meet more frequently to provide the oversight that Chris mentioned in his update earlier in our progress towards de-escalation. And then the last thing I wanted to highlight was we had our usual deep dive on 2 of the major programmes. Laboratory Information Management System and Radiology Informatics System Procurement, RISP for short. Again, we were assured that we had robust plans in place to deliver these, but I did want to highlight that essentially with these 2 programmes, they are recovery programmes. They transferred from the NHS Collab in 2023, and the programme that we are delivering against is compressed timescales based to the original procurement. So whilst we have problems delivering those, my personal view is we're doing a sterling job in delivering against compressed timescales. And that was the only things I wanted to highlight.
Thank you, David. Any questions or comments or observations? No, thank you. So we received that report, and then there's a second committee highlight report, which is the Audit and Assurance Committee, and invite Marion Wynne-Jones to pick out anything she wishes to highlight from the report.
Diolch Cadeirydd, a mae'n bleser gen i gyflwyno'r adroddiad yma yn codi o'n cyfarfod ni ar Ebrill yr 8fed. Yn cymryd bod chi wedi darllen yr adroddiad, ond gai jyst dynnu eich sylw chi gwpl o bethau. Fe dderbynion ni nifer o adolygiadau gan yr archwilwyr mewnol, ac roedd hi'n galonogol o gofio bod ni ddyddiau cynt wedi cael gwybod am newid yn ein statws ni fel sefydliad, ag chyhoeddiad y Llywodraeth i'n rhoi ni dan fesurau monitro gwelliant. Roedd hi'n arbennig o braf gweld fod adolygiad yr archwilwyr mewnol yn benodol ar reolaeth rhaglenni wedi derbyn graddfa sicrwydd rhesymol. Yr un raddfa hefyd i'r tri adolygiad mewnol arall. A fel sy'ch chi'n dychmygu, fe ddaru ni ystyried yr cynllun archwilio mewnol ar gyfer y flwyddyn ariannol newydd, ac i ni wedi cytuno yn sgil yn newid yn statws ar y rhaglenni mawr i adolygu'r cynllun yng ngoleuni'r datblygiad yma. Nifer o'r meysydd trafod eraill wedi bod yn agenda ni fel bwrdd y bore yma, a fel sy'ch chi'n gwerthfawrogi falle yn sgil yr heriau seibr cynyddol byd-eang bellach. Fe gytuno ni i gymeradwyo y cynllun blynyddol ar wytnwch seibr yn ogystal â'r cynllun blynyddol gwrth dwyll. Fe gafwyd hefyd sesiwn breifat, a dwi am dynnu'ch sylw chi i un adolygiad penodol gan yr archwilwyr mewnol ar brosesau recriwtio, ag roedd hi'n nodi mewn ffordd mae graddfa sicrwydd cyfyngiad oedd hwn, ond roedd gython ni sicrwydd fel pwyllgor bod na gamau yn cael eu cymryd i fynd i'r afel ar materion yn yr adolygiad yma, ac mi fyddwn ni wrth gwrs fel pwyllgor yn cadw golwg fanwl ar y camau gweithredu yma dros y misoedd i ddod. Diolch Cadeirydd.
Thank you very much, Marion. Diolch. Any questions, comments? No, we'll receive that report. Thank you very much, Marion. We move on then to the closing matters. I have had no urgent business, any other urgent business communicated to me. So we'll move on then. The date of the next meeting is Thursday, the 26th of June, which is the extraordinary public board meeting to approve the accounts and the annual report. And then the next scheduled board meeting will be on Thursday, the 31st of July. And that coincides with our annual general meeting. So that will be a long day, folks. If I now can bring the board meeting to a close, if I could remind you, it's if we could, as you know, we're having a briefing from Sam Hall so if I suggest 10 past 2, if everyone could come back, so that gives us just over a 5-minute break. Thank you all very much for your contribution today, and have a good rest of the day. Au revoir.
Diolch.